Good morning. The committee will come to order. The clerk will call the roll. Clerk will close the roll. The record will show that Senator Saslaw is here. Sorry, I'll get you next time.
Allegedly.
Can you strike the, let's clear the vote. The clerk will call the roll again. Everyone voted? Okay. Perfect.
Mr. Chairman, I've got a capital outlay. I'm going to leave my proxy with
Yes, sir.
Senator Locke.
Yes, sir.
Okay.
So good morning, everyone. If you don't mind, we're going to go over a couple of the expectations for the committee today. First, we are going to have an opportunity to hear from the Health Professions Subcommittee. We are also going to hear a number of the bills that have been introduced related to abortion services, hospital regulation. We also have 4 bills now related to family life education. With your concurrence, I think we're going to have an agreement that we may roll those together today. And then we also have some tuition grant programs that we're going to roll together. Today, we are going to hear from our new Secretary of Health and also our new Secretary of Education. We're delighted to have them here today. We also, for those of you that are in the audience, we're going to try to get in as many people as we can, and when maybe your bill is done or been heard, if you don't mind maybe transitioning out and allow others, we want as many people as possible to be able to hear their bill. Also, as has been the tradition in this committee for a number of years, we're going to be using a clock on the public comment portion. So you will see that we will set a clock as I understand it. It will show up in the upper right-hand side of this display. There will also be a display in front of you that you can see the clock there. By agreement, for the most part, there it is. By agreement, for the most part, most of the bills will be about 3 minutes. I've talked to Senator Locke and Senator Saslaw and also Senator Howe and others, Senator Lucas. And on some of the bills, I think we're going to extend that 3 minutes to something closer to 5 and 7 minutes, and we'll try to make sure we do it. But I will tell you this, that we have 30 bills on our agenda today. We have about 140 bills in this committee, and the ones that we're tending to put a clock on, we have heard in this committee many times. So we want to hear from you. The key thing in this committee is that if you are testifying and you have others behind you, I think you have a responsibility to others that are supportive of your position to state your position quickly and then allow the people behind you the opportunity, or the clock will run out. So with that, I'd like to invite Secretary Dan Carey to the podium. Secretary Carey and I have known each other for many years. He is from a town called Lynchburg, and he is a cardiac physician and one of the extraordinary cardiac physicians in my area. He has a distinguished career here in this Capitol, working with a number of groups on policy-related matters. He also has taken on an administrative role at Central Health in recent years, and just is a phenomenal choice, and I congratulate the governor for picking such a fine choice. So, Mr. Carey, welcome to our committee.
Thank you very much, Mr. Chairman and members of the committee. Thank you for this opportunity to come and introduce myself to the committee and also to outline the governor's priorities in this area. As Senator Newman pointed out, I'm a cardiologist by training. A little bit about myself. I went to high school in Hampton, Virginia, and college up in Charlottesville. And I have been in the Air Force as a cardiologist and have spent the last 21 years in Lynchburg in practice, as well as leading the Heart Center, the Cardiac Cath Lab, and the like. My heart is really, as a clinician, at the front line. These last 4 years, though, have been spent as an executive in my health system, learning how to build teams, learning how to execute with 8,000 employees on safety and quality and high reliability. And I hope to bring those interests and skill sets to the Secretariat. And it really is quite an honor, and I will do everything I can to to live up to the expectations of the governor in my appointment. I know the agenda is very busy today, so I'll be brief. We have slides, but I may forego those today. Really, the priorities are three in terms of what the governor expects of our secretariat and the work that we do as a team. First is the opioid crisis in Virginia. I don't need to outline all the details to this group, how important that is. We've seen a growth in the opioid deaths in Virginia rising since 2011 or so up to almost 1,200. And that's critically important to continue the efforts of the previous administration and the previous secretariat to build on those successes. And I'll just outline one of the most effective programs that we've seen is the ARTS program, which I think you're familiar with. And that is a program by which Medicaid beneficiaries are eligible for a wide array of treatment and recovery options. And it's been, in its first 5 months, we have data. VCU is adjudicating the data to look at its effectiveness. And we've seen a dramatic improvement in access. We are also getting preliminary data on decreased emergency room visits, increased success of treatment, more to come on that. But we've seen a 50% increase in those that are covered in getting treatment in the target populations. We've also seen a dramatic improvement and increase in the number of providers providing opioid disorder treatment as well as substance use disorder treatment. And we've seen significant improvement in that access. So one of the most important aspects of that, it's been based on the American Society of Addictive Medicine best practices, and I think has been well received around the Commonwealth. The other priority that I'd like to outline is that for behavioral health, STEP Virginia. Jack Barber and the team at the Department of Behavioral Health and Development of Services, as well as other teams within the Secretariat, have developed that long-term strategic plan for improving the performance of the community service boards. The goal is to make those services much more consistent around the state and decrease the variability in those services that are provided. I think that's critically important in getting higher value out of our investments in those areas. And I'll just outline the initiative that's been funded by this committee, funded by the General Assembly, and put into place in 2017. What we've seen is that 18 community service boards have had funding to improve same-day access. What we've seen in those recipients of those funds is that we've eliminated waiting lists, we've decreased no-shows, we've eliminated or reduced wait times, which of course was the goal, and we've increased walk-in services. For behavioral health, it's key at the community service board level to have patients or clients that need same-day assessment to be able to get it the same day. That decreases their need for hospitalization, decrease their use of the emergency room, and they get the care they need at the least costly setting. The third priority is really around Medicaid expansion. If things like the ARTS program and things like the first elements of STEP Virginia are showing promise, how do we then make them available for more citizens in Virginia? And we see that being done through Medicaid expansion. We see Medicaid expansion as a nonpartisan issue. We understand that this is a political body. There are perspectives across the political spectrum, but we see incredible advantage to providing resources for 400,000 uncovered Virginians that could benefit. Those resources would be used to improve their addictive services. They would be used to improve their behavioral health services. And of course, we're all paying for those patients already. They're showing up in our emergency rooms. They're being admitted to our medical hospitals and behavioral health hospitals. They're just not getting the care they need to have improvement in the least costly setting. So those are our three priorities. I will just close with saying that my work in the private sector at Centra, that you were so kind to outline, Senator Newman, was focused on high reliability, focused on safety and quality, and having metrics, not just about the outcome variables, but metrics about the key driver variables. If you want to decrease readmissions, if you want to have better access at the community service boards, what are the intervention steps that we think will lead to that, and what are our metrics around those interventions? So I think we do indeed need to be data-driven. I know that's a concern about many, and we agree with that. The other perspective is that in my work, I've seen the most important results come when we respected the front line. That is that frontline social worker who's trying to help a client, the frontline CNA at one of our mental health facilities. Are we doing everything we can to empower those frontline workers to give the best possible care or services to the patients, the clients, the consumers, the citizens that are depending on us? And in closing, I have a fair amount of experience in healthcare, a fair amount of experience in administration, but I understand this is a whole new ballgame for me. This is day 4, and with a little bit of a head cold, I know I'm not at my best today, but I know that I need to learn fast and learn well in order to provide for the citizens of the Commonwealth. And I'm very open in wanting input from this group as to how we can provide those services better. So thank you very much, Mr. Chairman, for this opportunity to talk to the committee and to introduce myself, and I look very much forward to working together in the months and years ahead. Thank you.
Dr. Carey. Are there questions for Dr. Carey this morning? Seeing none, I understand you have put together your staff, and we're delighted on that. And if you'd like to, at some point, kind of announce who your staff is, that would be helpful to the committee as well.
Okay, very good. Thank you very much. Thank you.
Great, thank you. Up next, we have our new Secretary of Education, and I'm going to mess this up. He's a delightful gentleman, Ativ Carney. Did I get it close?
That's perfect. Thank you, Senator.
Yeah, well, you're very nice. You don't know, I got training from my staff last night to make sure I got it right. It's a beautiful name.
I'm still practicing.
Great. We're delighted to have you here. I think you also have put together a tremendous staff and also a long history of involvement in education. For those of you in the audience that don't know, this committee really combines both education and health, which is 2 big committees in the House of Delegates. They come together in this committee. And, Ms. Secretary, we're delighted to have you here and look forward to hearing from you.
Thank you, Mr. Chairman. Is this thing on? I'm assuming it is, or push it? Got it. Thank you. I'm going to get used to that. Well, thank you so much, Mr. Chairman, and members of the committee. It's a pleasure and an honor to be here. My staff, we have for higher education, is Deputy Secretary Fran Bradford, who is here with me. Our K through 12 Deputy Secretary of Education, Holly Coy, is wonderful. She is home because her 2-year-old is not well today, so she'll be in a little bit later today. And we have an Executive Assistant, Rose Miner, who is wonderful. She's managing the operations at the office. So we have a great staff, and I am very fortunate. It was less than a month ago, on December 21st, when the governor came to my school in front of my students and colleagues and our staff announced the appointment. So it really is a dream come true. Going from the classroom to the cabinet has been a great experience so far. I want to tell you a little bit about myself. I served in the United States Marines for 8 years. I've been teaching for 10 years. They say once a Marine, always a Marine. What I also believe is that once a teacher, always a teacher. And I'm a 3rd-generation teacher. And I understand that our Commonwealth has a great educational system. I did my master's actually at George Mason University, one of our fine institutions. We have the best higher education institutions in the nation and I believe in the world. And I intend to build on our long tradition of education excellence. Horace Mann, who is considered as an individual who laid a foundation for the American public education system, he coined this phrase that education is a great equalizer. But in many places in the Commonwealth, it's become a driver of inequality. And for example, in Prince William County Public Schools, where I taught, the school I taught at was a Title I school. And just looking at what the resources we had at our school as compared to a school 2 miles down the road, it was like night and day. And we see that across the Commonwealth, and that's something that we hope to address together. And it's one of the things I want to emphasize is that there is a increasingly severe shortage of teachers, and there are budget shortfalls that we really need to focus on. It is hard to break into the profession of teaching. Teachers often burn out, and I know you've heard that over and over again. And thank you for your willingness. I know that the General Assembly has really addressed that with a lot of numerous bills related to education, and I'm reviewing them, so I really appreciate you really being proactive. And one thing I also realize is the problems across the Commonwealth are very different. So I intend to travel to every school division, every county in the Commonwealth, places like Lee County, places like Petersburg, and really look at things where how I can play a role in helping. So all regions of the Commonwealth, we have to engage them. We have to engage our students, our parents, our K-12, our higher ed, our business community. We all have a role to play, including our Senate and our House, Democrats and Republicans. We really need to collaborate together to continue to be the best, not only in the nation, but in the world. And we have to make sure that our teachers and our children have a cutting-edge curriculum. We need robust opportunities for work-based learning in high school. Governor Northam is dedicated in building a foundation that every student receives the education and exposure to career paths and work-based learning opportunities they need to be successful. In order to do that, we need high-quality teachers, and as you know, are well aware that teacher shortage is a big problem, not only in the Commonwealth, but across the nation, but we are going to address that. That's a top priority for us. And also another priority for us is work-based learning, and I believe that's also a shared interest for all of us. So I look forward to working together to implement the Board of Education's changes to graduation requirements and foster a robust work-based learning culture at the high school level in Virginia. We ask our students to be critical and creative thinkers. We ask them to collaborate and communicate. And that's something that we have to set an example for them and lead from the front. We also have to work together to communicate better, collaborate better. That's something that I hope to do as well, is have an open line of communication with everyone to see if what all the stakeholders want, and really try to be an advocate for everyone. It's been a wonderful 4 days. You guys have been wonderful, very welcoming. I have met some of you individually. It's been a great experience. I don't know why I didn't start this like a long time ago, but the 4 days have been wonderful, and I hope and I know that the next 4 years will be great working with you. So thank you for having me here today.
Great. Secretary, are there questions to Secretary Carney? No, we are delighted to have you here. I know
Yes,
that you
sir.
have a very fine staff you've assembled. We look forward to working with you in this committee.
Thank you, Senator. Thank you, Chairman.
All right, what we're going to do next, just so those in the audience can recognize what we're going to do. First, we're going to take up the Health Professions Subcommittee, only because it just has a couple of bills, and we can clear those out. You can do it from your chair, Senator Donovan. And then we're going to, without objection, we'll go to Senator Stanley's bill quickly. We've all heard that bill, and then we're going to go to the sign-up sheet, and there'll be some alterations to that. So, Senator Donovan.
Thank you, Mr. Chairman. I'm going to defer to Senator Suderline, who really took that committee.
Perfect. Senator Suderline.
All right, thank you, Mr. Chairman. On Senate Bill 315, by a vote of 4-0, the subcommittee recommended reporting the bill. This is Senator Ruff's bill, allowing licensed audiologists who have earned a doctoral degree in audiology to obtain a license in the practice of fitting and dealing in hearing aids without having an additional exam. They already have their doctorate.
Perfect. David, I think there's an amendment. Do you mind moving the amendment, technical amendment?
I move the amendment. Or, well, I guess I move that we report, amendment first.
Perfect. There's a motion and a second that the technical amendment be adopted. All those in favor will vote aye. Okay. Ayes 15, noes 0, and the amendment's agreed to. Senator Suderline.
And with the amendment on there, the subcommittee recommended a 4-0 vote to report, and I would now move that.
There's a motion and a second that Senate Bill 315 be reported. All those in favor will vote aye. Clerk, close the roll.
Yeas 15, nays 0.
Yeas 15, nays 0, and the bill is reported. Senator Suderline.
Thank you, Mr. Chairman. We also have your bill, Senate Bill 369, and Senator Donovan's Senate Bill 634, both dealing with the all-payer claims database. I think they were identical bills, and given the actions that have occurred since, the filing of the bills. We suggested continuing the bills to 2019, and I think you may want to send a letter on the subject.
So just a little bit of background before the motion, we roll these. We have been struggling a little bit with the all claims database, and we made a decision a few years ago to make it voluntary. There's been some push from everyone to make it mandatory. My bills and Senator Donovan's bill made it mandatory. We understand that since the bill has been introduced, the bills have been introduced, there has been great movement. And so it looks like everyone is lined up and everyone is willing to continue the voluntary. The letter that's going to be sent with your approval will say that this has kind of got to be worked out by September 1st. And if it isn't, this committee may very well work next year, right? So anyway, with that, the motion is that we roll together, and you can roll mine into Senator Donovan's Senate Bill 369 into Senate Bill 634. All in favor will say aye. Aye. Opposed, no, and it's rolled. I understand we can do those by voice. So then what we'll do then is there's a motion that the bill, Senate Bill 634, be continued into the 2019 session. All those in favor will vote aye. Clerk, close the roll.
Ayes 14, nays 0.
Ayes 14, nays 0, and those done. Senator Suderline, does that complete your report, sir?
Yes, sir.
Yeah, thank you very much. Without objection, we will now go to Senate Bill 866, which is Senator Stanley's bill. The reason is I think we've all heard this. Just to give you kind of the background on where we are, the bill, I understand, does have an emergency clause. I don't really care to get into all that here if we don't have to. It's just that for the committee's sake, the emergency clause does not impact the vote needed in case we need to get that point. Senator, you have had a public hearing. Do you mind describing once again briefly your Senate Bill 866?
Thank you, Mr. Chairman, members of the committee. This is a very simple, non-controversial bill that basically allows for the backdating of the license and certifications that Virginia gives to all of our hospitals. Pioneer Hospital Company was a Florida-based company that owned our hospital in Patrick County in Stuart, Virginia. When they went bankrupt and went into receivership, the hospital closed down abruptly in July of this year. When that happened, of course, we lost our federal accreditation, and our license and state accreditation expired December 31st since the hospital was not in use. This just backdates that, gives us a year to try to find a buyer for the hospital so that we can get it back up and running. Right now, it's critical for us to try to get this hospital up and running. Mr. Chairman, I will say that from my research and actually with the help of Senator Barker, what I've discovered is that this hospital not only was profitable, only 5% was uninsured or uncompensated care. So a lot of this was Medicare, 75%, because we have an aging population in Patrick County, over 75% was because of our elderly. So this is a critical hospital for the elderly in our area, and I'd ask that the bill pass or be reported.
So this bill is available on LIS. I think it's a great question. It was not on the docket, but through an understanding, talking with Hobie, we can put it on the docket. I can. And unless you guys, I mean, if you really seriously object, we can not do it. But it is on LIS, and so anyone in the general public has the ability to do it. Is there opposition to taking the bill up? Are we okay? Okay. Very good.
Mr. Chairman, I do have a question, though.
Sure. Senator Howe.
I guess to Senator Stanley. Is this the same bill that was on the floor a couple days ago?
Mr. Chairman, may it please, and I would answer the gentlelady by saying yes.
Okay. Any other questions about the bill, the substance of the bill, or any other item? Hearing none, is there a motion on the bill? There's a motion and a second that the bill be reported. Any discussion with that? If not, you will record your vote aye or record your vote nay. Clerk will close the roll.
Yeas 12, nays 0.
All right, yeas 12, nays 1, abstain 0. So with that, Senator Stanley, your bill will be sent to you. All right, was there a concern about the vote? Okay. With that, I will move that, or Senator Black will move that we reconsider the vote by which we just passed Senate Bill 866. All those in favor will record their vote aye. Opposed, no. The clerk will close the roll.
Yeas 12, abstains 2.
Okay, the bill is before us again. Is there a motion on Senate Bill 866? There's a motion and a second that Senate Bill 866 be recommended to be reported. All those in favor will vote aye. Opposed, no. The clerk will close the roll.
Yeas 11, abstains 4.
Okay. Yeas 11, nays 0, abstain 4, and the bill is recommended to be reported. Thank you, Senator Stanley.
Yes, Mr. Chairman, I do have another bill before you, and it's a quick one that the committee has heard before. Senate Bill 27, the TANF Scholarship Pilot Program.
Yeah.
May it please?
Okay. Yeah. So just do it quickly.
Yes, sir, I will.
So the committee will turn their attention to, and I don't know, the Senate Bill 27, which we have heard before, the pilot program, and it will have to go to Finance, Senator,
Yes.
if it does get out of
Yes.
this committee.
And this committee voted it out 15-0 before. There are some small line amendments and adjustments made by the Virginia Community College Association, which of course I have no objection to.
Clerk will report the line amendments.
Thank you, Mr. Chairman. On line 16, after 4, strike the remainder of line 16 through A on line 17 and insert any part of a student's cost of attendance not already covered by other grant aid at the. And then line 17, introduced after college, insert cost of attendance includes tuition fees, books, living expenses, transportation, and personal expenses. So it would read, the program shall provide selected students who meet the TANF eligibility requirements scholarships. Program funds shall be used to make payments for any part of a student's cost of attendance not already covered by other grant aid at the participating comprehensive community college. Cost of attendance includes tuition fees, books, living expenses, transportation, and personal expenses.
Other questions about the amendments? Is there a motion on the amendments? There's a motion and a second that the amendments be agreed to. All those in favor will say aye. Aye. Opposed, no, and the amendments are agreed to. Senator Stanley?
Briefly, Mr. Chairman, members of this committee, you've seen this bill before. It passed 15-0 out of this committee, but basically we get a block grant from the federal government for temporary assistance for needy families, what is known as, we all know it to be TANF. But a lot of that block grant money goes unused. But there are a lot of TANF eligible children out there, needy children, especially in underserved and underprivileged areas, rural and urban areas, that could use this money. The federal government allows, there's a small section that allows this TANF money to be used for education purposes. What this bill would do is create a pilot program using $800,000, not so much, but just in an underprivileged, underserved area that would provide a child from a TANF family, a TANF eligible family, to receive $4,000 for scholarship money to attend one of our community colleges. Basically, that would cover every bit of their cost. When we talk about free opportunities at college, this pilot program, this scholarship program would provide that to those children. If you can do this, especially these children are living at or below the poverty level, we could break the cycle of poverty for that child. That child would either have accredited, credentialed programs, certificates, two-year associate's degrees. Right there, we know that the income of that graduate, who would otherwise be at or below the poverty level, will be above the poverty level and significantly above the poverty level. So what we're trying to do is make the best use of these federal funds that we have to help those the most in need in our underserved and underprivileged areas, a rural area like mine, an urban area like here in Richmond. So that's the essence of the bill, Mr. Chairman, and I'd ask that it be considered favorably.
Great. We think we understand the bill. Are there those that are here to speak in favor of the bill? Is that what you are? If you could just state yours quickly, I think we're in pretty good shape on the bill. Welcome.
Hey, good morning, Mr. Chairman, members of the committee. My name is Salam Bhatti. I am the public benefits attorney at Virginia Poverty Law Center. So I'm very protective of how the TANF funds are being utilized. Sometimes people try to use them for non-TANF things, but Senator Stanley's bill is an excellent way of using these TANF bills to break the cycle of poverty. As a reminder to the committee, a family of 3 making $600 a month is getting $300 a month on TANF. So they really don't have any money to be going to college. So this is going to be a great way for them to go. So we urge you to support this bill.
Great. Thank you for coming today. Yes, sir. Welcome.
Good morning, Jeff Caruso with the Virginia Catholic Conference. We support the bill. We support opportunities like this to provide educational opportunities to low-income people. Thank you.
Thank you for coming. Yes, welcome.
Hi, my name's Laura Gordon, the Research Director at the Commonwealth Institute, and we support the bill for the reasons already stated. Thank you.
Perfect. Others? Yes. Yes, ma'am. Welcome.
Good morning. Kim Bobo, Director of Virginia Interfaith Center. We too support this bill.
Great, thank you. Are there those that have concerns about the bill? Hearing none, is there a motion on the bill as amended? And by the way, it needs to be referred, go to finance if there is a motion. There's a motion and a second that the bill be recommended reported and referred to finance. Any discussion on that? Senator Stanley, I just would say that I like your bill. I do think we have to upstairs weigh it against other TANF items. I think Janet and I and a few others will be doing that. But I think what you've come up with is a unique way to help the people that the TANF money is supposed to help. But that balancing act always has got to take place upstairs.
understand.
That's why we're going to send it up.
Thank you, sir.
With that, there is a motion to report as amended and refer to finance. All those in favor will vote aye. Clerk, close the roll.
Yeas 15, nays 0.
Yeas 15, noes 0, and the bill is reported and re-referred to finance. Senator
Thank you,
Stanley,
Mr. Chairman, for your
coming.
time, members of this committee. I appreciate it greatly.
Very good. Is Senator McDougal here? I know he's kind of signed up first. And Senator Deeds, if not, why don't you go and we'll wait for him to get here. Senator Deeds, you have emergency
673.
custody? Yep, 673.
And there's a
What-
substitute for it.
Okay. Does the clerk have a substitute handed out? Is there a motion on the substitute? All right, there's a motion and a second that the substitute to 673 be agreed to. All those in favor say aye. Opposed, no. And the substitute is agreed to. Senator
And the
Deeds.
substitute does virtually nothing from what the original bill did. It just makes it effective. In 2014, we made a number of changes to our mental health laws. And one thing we did was increase the ECO, emergency custody order period from 4 to 8 hours. We added 4 hours from that to give the CSB worker an additional period of time to look for a bed in the private sector, because we made public beds, public hospitals, providers last resort. We knew that would increase pressure, but we didn't really realize how much it would increase the pressure on the public hospitals. Some of them, most of them now are at over 90% capacity this year, and it's somewhat dangerous. So this is a tool. We put a 4-year sunset on this tool, but it's a tool that we need, I think we need to continue to try to reduce that pressure, to try to reduce the census in the public beds. That's simply what it does. Takes the 4-year sunset off that 4 hours.
All right. We remember doing this a couple of years ago. Are there questions to the patron? If not, are there those that are here to speak in favor of substitute to 673? Is anyone here to speak in opposition to the bill? If not, does the committee have a... The motion is that we report Senate Bill 673 in the form of a substitute. All those in favor will record their vote aye. Clerk will close the roll.
Yeas 15, nays 0.
Yeas 15, nays 0, and the bill is reported. Thank you, Senator
Thank you very
Deeds, for
much.
coming before us. Senator McDougal, we called you earlier. If you don't mind coming up. In the meantime, would the committee consider bringing their attention to Senate Bill 709? Senator Wexton has asked that Senate Bill 709 be stricken, and I'd entertain a motion. There's a motion and a second that Senate Bill 709 be stricken from the calendar. All those in favor will record their votes aye. Opposed, no. Clerk will close the roll.
Yeas 15, nays 0.
The yeas 15, nays 0, and the bill has been stricken. Senator McDougal, welcome, and you have a bill before us.
Thank you, Mr. Chairman. Mr. Chairman, I was in another committee, and my assistant has my file, so we're going to wing it, but maybe we can do 411 first.
Yes. Clerk, the committee will bring their attention to Senate Bill 411.
Mr. Chairman, this is a bill that came out of the Code Commission, and as we looked, Code Commission, as the committee knows, looks at a number of different things. One of the things we look at is if there are inconsistencies. As we went through the code in reference to appointments, particularly to higher education, there was discrepancies in different places about whether those appointments expired when the new person was sworn in or at the end of the term. And so this will bring some consistency to that direction.
Okay. Are there any questions about 411 from the patron? Is anyone here to speak in favor or in opposition to the bill? Is there a motion on the bill? There's a motion and a second that the bill be reported. There is, would you like to speak? Would you like to speak?
Good morning, Mr. Chairman, members of the committee. Beverly Covington with Chev. This cleans up a section of our code relating to when our council members come on board, and we appreciate them catching the discrepancy. Thank you.
We're always delighted to have you. Thank you for coming by today. With that, all those in favor of the bill will record their votes aye. Those opposed, no. Clerk will close the roll.
Yeas 15, nays 0.
Yeas 15, nays 0. The bill is reported. Thank you. And Senator McDougal, you have 413?
413, Mr. Chairman, I believe there's a substitute.
Yes. The clerk will hand out the substitute. Is there a motion on the substitute? There's a motion second that the substitute be agreed to. All those in favor say aye. Opposed, no. And the substitute is agreed to. Senator McDougal, is this kind of the compromise that's been worked out over the?
It is, Mr. Chairman.
Okay.
Mr. Chairman, I'm not aware of any opposition. This was worked through the Board of Pharmacy. The issue came up particularly from providers of dialysis equipment. There are certain medications that are typically dispensed at the same time those medical devices or parts with the dialysis move forward. And like catheters, ostomy bags, and other types of actual physical devices are provided, and this would allow the practice that has candidly been in place for a long time to continue under our Board of Pharmacy regulations to allow the medications that typically are administered at the same time to be delivered at the same time.
Okay. Very good. Are there questions to the patron? Are there those that are here to speak in favor of the bill? Scott, welcome.
Good morning, Mr. Chairman. Scott Johnson. I want to thank the Board of Pharmacy, Caroline Jurin and Elaine Yates at Health Professions. We've worked on this since the spring. Be glad to answer any questions you have.
Great. Is there anyone here to speak in opposition to the substitute? Hearing none, is there a motion on Senate Bill 413? There's a motion and a second that Senate Bill 413 be reported as a substitute. All those in favor record their votes aye. Those opposed, no. Clerk, close the roll.
Yeas 15, nays 0.
Yeas 15, nays 0, and the bill is reported.
Thanks, Mr.
Senator
Chairman. Hope
McDougal,
the rest of
for
your
coming
day is equally as uncontroversial.
by. It'll be fine. We're all happy. All right, up next, we have Senator McClellan and Senator Wexton, Senator Favola. You all have a version of what is a family life bill, and also Senator Servell. And the committee will operate by motions as always. There is a substitute that I hope all of you have seen that I think a lot of you are good with, and there may be some on the committee that are not, but it does basically take almost all the information in the bills and it consolidates them into a single bill, so we have a single policy coming out of the committee. So with that, Senator McClellan, why don't you describe your bill, and then we'll talk about the substitute, even though it'll be handed out, but we'll understand the substitute before we vote for it. So welcome.
Sure. So this is Senate Bill 101. You recall last year we added to the curriculum for family life education information about the law of consent, including that consent is required for sexual activity. What this bill would do, but when we passed that bill, it was permissive. This bill would make that mandatory. It doesn't make FLE mandatory, that's still permissive, but it would make the information about consent being required for sexual activity mandatory. And here's the reason for it. The intent of this bill really was that once you start teaching sex ed, you really need to make sure that the high school students know sex without consent is a crime. Virginia has made a public policy statement that anyone under the age of 18 by law cannot consent to sex. There are criminal penalties for that. The younger the child, the higher the penalty. But a lot of our students don't know that. A lot of our students need to know that. And I think what the past year has shown us is it is very important that we start teaching this now. Because I think what we've seen in the past year with a high number of reports of sexual harassment, in some cases sexual assault, We really need to let our students know when they start learning sex ed that sex without consent is sexual assault, and you can go to jail for it. And that's the bill.
Senator, we really appreciate you coming forward with the bill. We did work with you last year. There's been a couple of word changes in her section of the bill.
Yes.
Basically, it is now located on line 21, and it speaks about the consequences of non-consensual sexual activity, conduct, and touching. And I think you're okay with that
Yes.
small change. So
Yes.
with that, let us hear from some of the other senators, and then the committee will decide whether they want to move forward with that or the substitute. So, Senator Sarabel, welcome.
Thank you, Mr. Chairman, members of the committee. Mine's pretty simple. Mine simply asked that children, as part of family life education, also be educated about sexting. Sexting is a huge problem. A lot of children don't understand that when you send a naked picture of yourself to another child, it's actually a felony. It's a creation of child pornography, and even having it on your phone as a possession is a felony. And I can get further into it, but I attended a conference on it about a year ago, and I think one of the best things we can do to prevent this from happening is engage in more education and prevention instead of trying to deal with it on the back end, where our educators and administrators in schools are having a really hard time just even figuring out how to deal with it when they discover it. And so that's all my bill does, and it's also something the Department of Education is pretty much they're already starting to do as part of the guidelines.
Senator Sarabel, as you know and you've seen, I'm sure, on line 23, basically we picked up your language and moved forward with it.
Right.
I appreciate you bringing it forward to us. I think it'll be helpful as we move forward, trying to educate our young people.
Mr. President, Mr. Chair.
Yes, Senator Peterson.
And this is a question maybe more for Senator McClellan, but when we talk about non-consensual sexual activity, would that include statutory rape? Because we have, someone who's 14 years old can consent to have sex with someone who's 16 or 17 years old, and that's illegal. And we have situations where those children are going to jail and being branded a registered sex offender for the rest of their lives for activity they might not realize is illegal.
Right. Well, that's the whole point, actually. Any sexual activity with someone under 18 is a crime, and so that includes statutory rape.
So that would be included in non-consensual?
Yes, because by law, if you're under 18, you can't consent.
Okay. All right, that's fine.
And Senator Wexton has deputized me to address hers. And I think her bill is on lines 25 to 26, and that is to include information on the prevention, recognition, and awareness of child abduction, child abuse, child sexual exploitation, and child sexual abuse. Again, age appropriate. Again, here, I think it's very important that we begin to teach our children how to understand when somebody is exploiting them, or when what to do if they might be in that situation, and how to avoid it, and what to do if you might be abducted. And I know there are some organizations, including the Boy Scouts, that are starting to address this information, but not all of our children in our schools are in organizations that are getting this information. They're not all getting it from home, and sometimes, just being aware of what the dangers are can help save them from falling into those dangers.
Thank you and we appreciate the work of Senator Wexton as well. Also, Senator Favola, you also had your bill, and if it's okay with everyone, and we'll see what the committee does, but we were thinking about making Senator Wexton, Senator Sarabel, and Senator Favola chief co-patrons if we merge them together.
Thank you, Mr. Chairman. I just briefly looked at the substitute that I believe is before the committee, and I did not see the language that I would like added to the family life education program section of the code. The standards of learning in a curriculum has been developed by the Department of Ed, and we identify the different topics that will be covered under family life. And in my bill, I merely add the words medically accurate information relating to the discussion on human reproduction. So,
Senator Favola, thank you very much. We appreciate that. We were kind of looking for you, but we didn't know what problem it was trying to solve. In other words, what is the medically inaccurate information? Maybe you can help us with that information.
Well, I do believe that the Department of Ed, and I think Cindy Cave is here, the Department of Ed has created a curriculum that does have some medically accurate information. I hope all of it is medically accurate, but I was merely putting that into statute so we don't ever risk the fact that evidence-based or medically accurate information would not be part of the curriculum.
Right.
So I'm not creating something new. I'm articulating a value that when we talk about this, we've got to be fact-based.
We were understand. Thank you. We didn't quite get that nuance, but it's very helpful to understand. Thank you very much.
Okay.
And are there those that are here to speak in support or in opposition to the bills? Welcome.
Good morning, Mr. Chairman, members of the committee. My name is Victoria Cobb. I'm the president of the Family Foundation. There's some valid concepts in here and important things to teach. The bills treated very differently the issue of age appropriateness. And so what we want to make sure is that age appropriateness runs the entire gamut of every new concept that we're putting into here. As you might imagine, I have children from 4 to an 11-year-old, girls and boys. How I teach things like consent and how I teach things like sexting would be very different on the low ends of those and the others. FLE, I appreciate Senator McClellan's point about high schoolers, but FLE is taught at different ages in different localities. So we want to ensure that age appropriateness is contained throughout every new concept we're putting in here. Thank you.
Okay. We appreciate that. The discussions that were had, I think, with all the patrons, everyone wanted the age appropriateness to continue. And Tom, if you can just look to make sure that which I think all the patrons are hopefully in favor of, is cleaned up in the code. But I think it's there. We left
It actually
there.
it is in there. If you look at line 16 and line 22, includes age appropriate.
That was our hope when we put the substitute together, so I think it's still there. But anyway, others that are here speak in favor of the bill or in opposition? Yes, welcome.
Mr. Chairman, members of the committee, I'm Kathy Bircher with the Virginia Education Association, and we support this bill and the substitute.
Great. Thank you for your help. Hello, welcome.
Chairman Newman and members of the committee, my name is Ariana Shahidi, and I'm a senior in Richmond City Public Schools. I support Senate Bill 843 that requires medically accurate sex education for students like me, because 2 years ago I went through the sex education program at my own school, and in class we lacked open and informative up-to-date discussion about topics related to sex. The focus was mainly on sexually transmitted diseases. While incredibly important, shouldn't be the sole focus, because topics such as birth control, sex, and consent are very critical as well. Even worse, my friends in the LGBTQ community were completely ignored as well. The only information we received was about boys having sex with girls, and that's not right at all. So I respectfully ask that the members of this committee take a small step forward and pass Senate Bill 843 to require school systems to teach medically accurate sex education. Thank you.
Thank you. Thank you for coming. Others that are here speak in favor or in opposition? Welcome.
Hi, my name is Shayla Lothe. I'm a high school student at Henrico County Public Schools and a constituent of Senator Donovan. I just wanted to say that I'm in favor of this bill.
Thanks for coming by. Yes, sir. Welcome.
Mr. Chairman, committee members, Jonathan Glacius with the Virginia Sexual and Domestic Violence Action Alliance. We are in support of this bill. We see this as a much-needed sexual assault prevention measure, and we see this as an expansion that brings us up to speed with the 28 other states that already require consent education, and the 18 other states, including the District of Columbia, that include that medically accurate language. So.
Perfect. Thank you for coming. Yes, ma'am. Welcome. Thank you for coming.
Mr. Chair and committee members, Jennifer Allen with Planned Parenthood Advocates of Virginia, and speaking in support of this bill and the substitute, as long as medical accuracy is included in the substitute.
Right.
Thank you.
Thank you for coming. So, Senator Wexton, as you recall, Senator McClellan did a fantastic job describing your portion. Would you like to say anything else?
No, Mr. Chairman, I don't think I could possibly improve on what she said.
Well, thank you for working with us on the substitute. Very good. If there's no one else left to speak, what is before you, I'll take some responsibility or blame for it, but it is a bringing together of most of the provisions. Senator Favola's item wasn't in there because we thought that it was currently medically accurate information, but we do have all the information from Senator Wexton and Serville and also McClellan. So with that, Senator, would you like to say something?
Mr. Chairman, I would just ask the committee's indulgence to literally state that medically accurate be part of the statute, just as we have abstinence, which had been part of the curriculum, but the committee had made a policy choice to articulate abstinence education, I think it would be a wise policy choice to articulate medically accurate.
Perfect. Thank you, Senator. So if we go down through it and someone else have to make the motion, basically we have incorporated the elements of evidence-based information, which we hope got a bit to Senator Favola's information. We also got to the dangers and repercussions of using social media, which is Senator Surville. We also got to Senator McClellan's mandate, which is the only part of the bill that actually mandate. And then we also have in here Senator Wexton's bill, which is the last part of the bill. With that, is there a motion on?
I have a question. Have we adopted the substitute?
No, we were just kind of talking about it before we adopted. If
All
there's a motion, it would be whether and which bills we roll in.
Right.
So is there a motion on the bills?
Yeah,
Mr. Chairman.
Go ahead, Senator.
I would move that we roll all those bills except for Senator Favola's bill into 101 and vote on them.
So you want to also include Favola's bill as well?
Yeah, okay.
Yeah, very good. So there's a motion that we roll all the bills together into Senator McClellan's bill, which is Senate Bill 101. All those in favor will say aye.
Aye.
Those no. Before you is the substitute. Is there a motion on the substitute?
Move the substitute.
So motion is second that the substitute be agreed to. All those in favor say aye.
Aye.
Opposed, no, and the substitute is agreed to. Tom, is there any technical amendments that are needed in the substitute?
Thank you, Mr. Chairman. I might add a couple of Romanettes just to make sure that incorporate age-appropriate elements of effective and evidence-based programs follows to both the prevention of dating violence and the consequences of non-consensual.
So all of it will be age appropriate. Okay, any opposition to that? Hearing none, is there a motion on the substitute?
Move the substitute.
There's a motion and a second that Senate Bill 101 be agreed to. All those in favor will vote aye. Opposed, no. Clerk will close the roll.
Yeas 13, nays 1.
Yeas 13, nays 1, and the bills are agreed to. Thank you all for coming.
Thank you. I have another
Oh, I
one, but I
thought
don't
I
know if you
voted.
want to do that now or later.
You have another bill?
Yes.
That's right, you do.
Mr. Chairman, it looked like I didn't vote. Please just put me down as an affirmative vote, please.
Do we need to do that, or do we need to help by recording the vote? We don't mind reconsidering for the senator. Is that okay? All right. All those in favor of reconsidering the vote by which we passed, I think it was 101, we'll say aye. All opposed, no. And the bill is back before us. Is there a motion on the bill? There's a motion and a second that the bill as amended in the substitute be reported. All those in favor will record their votes aye. Opposed, no. And the clerk will close the roll.
Yeas 12, nays 3.
All right. With a 12-3 vote, the substitute is approved. Senator McClellan, thank you and welcome back.
Sure. Thank you. Senate Bill 292 clarifies that when a woman who qualifies for state medical assistance reports to a public health agency that her pregnancy is a result of rape or incest, the Board of Health will fund her abortion without requiring an additional report to law enforcement. This bill is consistent with a policy we adopted in, I think it was 2006 or 2007, related to PERT kits, that PERT kits, a victim will not have to pay for a PERT kit if she does not agree to report a sexual assault to law enforcement. And unfortunately, a lot of survivors of sexual assault, rape or incest in particular, are just not ready to report to law enforcement. But and sometimes it takes years to be ready to report to law enforcement. But the decision of whether or not to terminate a pregnancy needs to be made in a pretty quick time frame. And just to give you a few statistics, only 310 out of every 1,000 sexual assaults are reported to police. So 2 out of 3 go unreported. The reasons are varied, but based on a recent survey, 20% of survivors feared retaliation. 13% believed that the police wouldn't do anything to help. 13 believed that it was a personal matter. 8% reported to someone other than law enforcement. 8% didn't feel it was important enough to report, which is incredibly sad to hear. 7% did not want to get the perpetrator in trouble. 2% didn't believe the police would help, and 30% gave either didn't cite a reason or said something other than one of those categories. So again, it's just when you're going through the emotional turmoil of dealing with rape or incest, I think you need to take care of yourself before you and sort of the medical consequences of that before you decide whether to go to the next step and report to law enforcement.
Senator, thank you so much for coming. Are the questions to the patron?
Yes, Mr. Chairman.
Yes, Senator Peake.
Yes, Mr. Chairman, thank you. So, Senator McClellan, what would prevent any woman who is pregnant from going and saying they were a victim of rape or incest and having that abortion funded by the Commonwealth?
Well, I suppose if you want to add, they have to sign a sworn affidavit under penalty of perjury, you could do that. But I think if you were concerned about that.
Senator Peake, does that complete your question? Sure. Other questions to the patron? If not, thank you very much. Are there those that are here to speak in favor of the bill and those who are here to speak in opposition? To be clear, there will be a 5-minute clock by agreement on this bill for both sides. So at that point, we'll cut off debate. Welcome.
Good morning. My name is Stephanie Feesmith. I'm a resident of Annandale, and I'm reading on behalf of Audrey Ford, a constituent of Senator Peterson. I'm testifying today in support of SB 292. I was raped in 2014 and had an abortion. I was privileged, unlike other women in this country, to have employer-covered insurance to support my choice to terminate my pregnancy, which is why this provision is not fair to the disenfranchised rape and incest survivors. This is about safety and health. My rapist was never brought to justice, but I work to advocate for those in silence. Thank you for your time.
Thank you so much for coming today. And by the way, if you do have written testimony and the clock gets to be a little bit of a problem, I've asked the clerk to receive your written testimony that we'll make part of our record. So welcome.
Thank you. Good morning, committee members. My name is Nicole Grimm. I'm a resident of Alexandria, and I am here on behalf of Caitlin Blenny, who is a constituent of Senator Saslaw. I was sexually assaulted in college. I did everything I thought I was supposed to do. I said no multiple times, and I tried to escape. After my attack, I shut down. I desperately needed medical care. My attacker removed the condom during the assault, and I was left bleeding. But I was scared, embarrassed, and ashamed of what had happened to me. I was spiraling into depression and alcohol abuse. It took me 3 days to see a doctor. It took another month until I was ready to take legal action, which was the hardest experience of my life. I know that if I had become pregnant from the attack, it would have killed me. As a broke student on Medicaid, Virginia's current law would have made it impossible for me to afford and access an abortion. Pregnancy should never be a punishment. Survivors should be supported. Passing this bill will help restore survivors' ability to control their body after it has been forcibly taken from them. Thank you.
Thank you so much for coming. Are there others to speak in favor of the bill? Welcome.
Good morning, Senators. My name is Galina Varchena, and I'm from Nair, Rochester, Virginia, and we support this bill.
Great. Thank you, ma'am. Yes, sir. Welcome.
Chairman, committee members, Jonathan Iglesias with the Virginia Sexual and Domestic Violence Action Alliance. On behalf of our 62 member agencies, which are rape crisis centers and shelters across the state, we support this bill.
Thank you for coming. Yes, sir.
Good morning. I'm Aaron Goldberg. I'm here representing the Virginia section of the American Congress of OBGYN, and I'm a practicing OBGYN. I completely support this bill as someone who cares for these people after these assaults and some of the patients you've heard from it. It's an important bill. We support it. Thank you.
Thank you. Yes, ma'am. Welcome.
Mr. Chair, committee members, Jennifer Allen with Planned Parenthood Advocates of Virginia. We strongly support this bill to assure that survivors of assault can access the services that they need. Thank you.
Thank you. Welcome. Yes, ma'am.
Good morning, Mr. Chair, members of the committee. Anna Scholl with Progress Virginia, and we also strongly support this measure.
Well, great. Thank you for coming. Secretary Carey.
Dan Carey, Secretary Carey, on behalf of the administration, we support this bill.
Great. Thank you for coming today, sir. Okay. Are there those that are in opposition to the bill? And what we're going to do is we're going to stop and reset and go back to 5 minutes. And if you have written testimony, you're welcome to provide it too. So welcome, yes.
Mr. Chairman, members of the committee, my name is Olivia Gans Turner. I'm the president of the Virginia Society for Human Life. We oppose this bill on the grounds that women need care, assistance, that is true, but they also very often need legal provisions that our system provides. We see this bill as an undermining, a grievous undermining of the necessary protections that too many women go without, as is witnessed by recent conversations in our culture. We oppose this bill and we ask you to do the same. Thank you very much.
Okay, thank you for coming. Others that are in opposition to the bill?
Hi, my name is Victoria Cobb with the Family Foundation. The women who step forward in these situations are some of the bravest women I know. We're in a unique environment where women are finally stepping up. I don't think this General Assembly should send any signal that that is not good, important, and worthy. And I just think this bill sends the wrong symbol to our women who are finally being bold.
Great, thank you for coming. Yes, sir, welcome.
At Yale, Virginia Assembly of Independent Baptists, our concern, I think, were expressed by Senator Peake of using federal money when it's not been, or using state tax money, our tax money, when it's not verified. And I think that the woman needs to have this reported. I know it's extremely hard and it is a horrible situation, but again, it's our concern.
Great, thank you for coming. Yes, sir.
Mr. Chairman, members of the committee, thank you. Bill Ray with the Virginia Catholic Conference. We oppose this bill for the reasons stated here. Thank you.
Thank you all for coming. Sir McClellan, you mind if just kind of wrapping it up, if you don't mind?
Sure. I think part of what we've seen in the past year is that for some women who have been sexually assaulted, it takes years before they reach a point where they can step forward. I don't think they should be punished for it if they're not ready to report to law enforcement, but that they have made the very difficult decision to terminate that pregnancy. It's consistent with, we used to require that if a woman, before we would collect forensic evidence from a PERT kit, she would have to agree to report that assault and press charges. We made a decision not to re-victimize victims in that situation. I think this is the next step.
Sure.
Thank you.
Well, Senator, thank you for coming. Thank you for your eloquent discussion. Does the committee have any other questions? If
Mr.
not,
Chairman.
Mr. Chairman.
Yes, Senator Black. Did another? Senator Black, okay.
Mr. Chairman, I think everyone here has tremendous sympathy for victims of rape and certainly tremendous interest in punishing the offenders. But I think this particular bill opens the floodgates for state funding of abortion. It certainly invites fraud in using state funds in order to fund elective abortions, and for that reason, I oppose the bill.
Okay, Senator Locke.
Mr. Chairman, I applaud Senator McClellan for bringing forth this legislation. I think that I'm probably the only person sitting up here who's been a victim of incest. So I appreciate your doing this. So I think that women coming forward now is very, very important. And I don't think this opens the floodgates to anything other than women ending their victimization and being allowed to end that victimization. And I think that to simply say that women are going to come up and say, oh, give me an abortion, to ease their way out of an unwanted pregnancy is foolhardy. I'm just, upset at the fact that people think that way, and feel that way about us as women, and that we would deliberately do that. That's why women have been silent for so long and have not voiced, how that they have been raped and sexually assaulted or have been victims of incest because of the thinking or some of the thinking that I've heard here. So I applaud you for what you're doing. And that's why I support this legislation.
Senator Locke, thank you very much. Also, Senator Peake, did you want to speak any more? It's still on the board. All right. Any other senator like to speak on this bill? Senator Chase.
Thank you, Mr. Chairman. First of all, I understand where you're going with this bill, and certainly as a mom of 4 teenage kids, a daughter and 3 sons, I think I have a very unique perspective to this whole bill, and that is one of protecting both our men and women and situations in which alcohol is involved. You know, we all know many situations in which alcohol is involved and there's not a lot of memory after an event that takes place. And I want to ensure that not only the women are protected, but that we are using the legal process that's in place, and that's not taken away from the fathers who, I mean, I've heard court cases where the father had no idea that the woman was even pregnant and would have supported that situation. So I don't think we want to take the law aspect. I mean, I'm a mom, I'm a woman. I mean, I get it. We've all been in those situations. We all know somebody who has been through those situations, and we want to be extremely compassionate in those situations. But as a mom with boys as well, and someone who defends life, I would want my boys to have the opportunity to bring healing to that situation, comfort to the situation, and take responsibility for their actions. And I think one thing that's missing from that bill is the response to hold our young men accountable as well for their actions. So thank you.
Thank you, Senator Chase. Others on the committee? Senator Carrico. What's your motion? There's a motion and a second that Senate Bill 292 be passed by indefinitely.
Substitute motion.
There's a substitute motion. You state your motion.
That the bill be reported.
Okay. There's a motion and a second that the bill be reported. Substitute motion. All those in favor of reporting the bill will record their votes aye. Those opposed, no. Has everyone voted? The clerk will close the roll.
Yeas 7, nays 8.
Yeas 7, nays 8. That motion failed. All in favor of the motion to PBI will record their votes aye. Those opposed, no. Has everyone voted? Clerk, close the roll. To PBI.
Ready?
Yes.
Yeas 8, nays 7.
All right, the bill is PBI at 8-7. Thank you very
Mr.
much for
Chairman.
coming today. Thank you for your presentation. Up next, we will hear from Senator Reeves. So, Senator Reeves, if you don't mind, we do have multiple bills on this topic too, and I think we have Senator DeStaff and Senator Reeves, and there's also one from our own Senator Cosgrove. Could you maybe give an explanation of your bill, and then there may be a decision to have a single bill go out of this committee, which would be rolling them together. So Senator Reeves, welcome.
Thank you, Mr. Chairman. I think Senator DeStaff is going to make a motion later to strike his bill rather than roll it. So I think that would leave Senator Cosgrove bill. But ladies and gentlemen, yesterday, for those who attended the briefing by Major General Williams, we were given the knowledge of where our National Guard stands and some of the challenges that we face and the environment that we face in today's ever-changing world on security and the security threats that we face as a Commonwealth, and the challenge that the Virginia National Guard has in maintaining our force and our force structure. We've talked at length about how we can shore up our National Guard, make sure our recruiting is going well, and that we can have a force that not only can respond stateside, but also in various parts of the world on the war on terror, which we've sent about 18,000 of our guardsmen forward into theater. This legislation is just a huge recruiting initiative, and what it does, Mr. Chairman and members of the committee, it provides that certain members of the Virginia National Guard who are enrolled in an accredited proprietary private institution of higher education are eligible to receive education grants. And under current law, only members who are enrolled at public institutions of higher education or accredited nonprofit private institutions of higher education are eligible for these grants. The bill provides that the cost of textbooks would also be included in the calculation of the grant amount. The bill clarifies that the eligibility requirement of 2-year remaining obligation is from the last day of the semester or term in which the grant is awarded. I do have someone here from the National Guard that can talk more about it, but the bottom line is if we're going to continue to be able to field a force for our Virginia National Guard, we've got to do some things that allow our guardsmen the opportunity and incentive to do that. You know, members of our Guard serve all around us. We know that they've just done a lot for us. They went to Houston, they helped the folks that were flooded there. They just went out to the islands and helped those folks during this winter. But we're losing those folks as they go through multiple rotations in the war on terror and coming back. I think the general mentioned yesterday, for the first time this Christmas, we've had all our guardsmen home, and that's a rare thing. But I think without divulging classified information, I think we're in a different footing today than we were a month ago. Those of you that were in that brief understood what the general was saying about that. And so as we move forward, we're definitely going to have to help with this, and this will do that. So with that, Mr. Chairman, that is what the bill does.
Perfect. Thank you very much. Senator Steph, given your posture, why don't we just take yours up after we're done with these, and then that way we'll let you speak briefly and then make your motion to strike. Is that okay, sir?
Yes, sir.
Thank you.
Mr. Chairman?
Yes, Senator Cosgrove.
Mr. Chairman, I have a bill that's similar to this, but I would ask that my bill be rolled into Senator Reeves' bill. I'd like to co-patron if possible.
Okay, so we will entertain a motion to roll Senate Bill 849 into Senate Bill 462, making both chief co-patrons. There's a motion and a second. All those in favor will say aye.
Aye.
Opposed, no, and those bills are rolled together. Are there those that are here to speak into the new bill 462? Senator, do you have those that are speaking here in favor of that bill?
I do have members from the Guard that if you want to hear from them, if you don't, based on time, that's fine.
With great respect, we'd love just to hear from them briefly if they're willing to address us quickly. We're delighted.
Come on up, Colonel.
Sir, Lieutenant Colonel Russell Woodleaf with the Virginia National Guard. Senator Reeves certainly set out the bill. This is a fantastic recruiting tool for us. We need it, especially at this time. The inclusion of for-profit colleges, which many of our guardsmen use nowadays, and the distance learning ability of some of those for-profit colleges is, again, a great recruiting tool for us. It helps get new guardsmen in, helps us keep the guardsmen that we have. Inclusion of the books, again, helps out with recruiting greatly. And the last change is simply to clarify the service obligations, so there's no confusion about that. But
great. Thank you for coming today. Thank you for your service.
Yes,
if moving forward, is anyone here in opposition to the bill? If the bill is recommended to be reported, it does need to go upstairs because there's some financial items on the bill. Senator, you want to finish up, and then we'll hear from Senator Cosgrove, and
Mr.
then
Chairman,
we'll make a motion.
That completes the bill unless anyone has any questions.
Great. Senator Cosgrove.
Thank you, Mr. Chairman. Yeah, I'm pleased that this bill has come forward. My bill actually would have also included tuition assistance grants to institutions that are, quote, not nonprofit. However, this is a good first step. Our guardsmen had the opportunity to get some very, very good training that not only helps themselves and regular industry, but can also help the Guard and they're completing their missions whenever we ask them to do so. That being said, Mr. Chairman, I would make a motion that we report the bill as amended.
Right, and re-refer to finance.
And re-refer to finance,
right,
yes,
there's
sir.
a motion and a second that we report the bill. That is 462, and re-refer to finance. All those in favor record their vote aye. Opposed, no. Clerk will close the roll.
Yeas 15, nays 0.
15-0, the bill is reported and re-referred to finance. Thank you all. Senator DeSteph, welcome.
Thank you, Mr. Chairman, members of the committee. Today we're going to talk for a minute or two about Senate Bill 660. And with that, I just really wanted to talk about the tag process, the tag bills, the tag grants. And the grants really are they're not for Virginia colleges, but for Virginia students. Tag grants are awarded to the students, not institutions. And they should be allowed to use them in private colleges, whether the private college is for-profit or not for-profit. And I think that we really need to have a level playing field. And if we look at this from a workforce development standpoint, a lot of our private colleges, for-profit or not-for-profit, really focus more on our military members. So if you look at this, Liberty University, they've got about 20,700 military members that actually use military benefits and go to Liberty. ECPI, which is a for-profit in my area and across parts of the state, they do right over 2,300 military students. Well, ECPI with the 2,300 is more than our top 25 colleges private in the state of Virginia. They handle more military members with that. So understanding that my bill has one or two challenges, I would like to carry it over, but really I'd like to focus maybe over the summer on how do we do something for our military members outside of the National Guard. I am a chief co-patron on Senator Reeves' bill. It's a fantastic bill. It is a great first step, as Senator Cosgrove said, but I really think we need a true level playing field. And I don't know if we call it TAG grants P or for-profit or something else, but I truly believe that, you know, TAG grants were set up to follow the students, not the institution and not the college. So as we look at the intent of why they were set up, I think we really need to provide a level playing field. These private colleges, whether they are for-profit or not for-profit, they still have to follow the same regulations. They still have the same reporting requirements. They still have everything that the other has to do from an administrative standpoint. So I think we should have a level playing field and truly offer TAG for private for-profit and not for-profit. Maybe we call it something else. I'm working with Peter Blake with Chev. I've asked him, you know, how many students will this impact? They really haven't had a chance to scrub out that number yet to see what the cost would be. I don't know if it'd be 100, 1,000, or 10,000, but hopefully by this time next year, we'll have a number. I'll know what the financial impact of this will be, and truly we'll have a bill that's in line, ready to go. So with that, if it pleases the committee, we'd like to strike the bill.
Okay, great. Thank you. There's a motion to strike. Oh, there's not a motion. Anyone that feels a need to speak to the bill that's going to be stricken, Reggie, maybe quickly, if you don't mind, sir.
Very quickly, Reggie Jones, representing the Council of Independent Colleges in Virginia. That's the nonprofit colleges. We appreciate what the legislature does in supporting the 22,000 Virginia residents who attend the not-for-profit colleges and universities in Virginia. We would be very supportive of what you might decide to do in connection with the request from Senator Cosgrove and from Senator Steph in a separate fund, and please do not ask you not to integrate that with the TAG program. It's difficult enough for us to get the grants that we're getting for the Virginia students in the TAG program, and we would hope that it would not take that away from the students and dilute the program.
Thank you for coming today. We appreciate it. Are there members? Senator Black.
Mr. Chairman, I applaud the patrons' intent on this, and we certainly want to give the students the opportunity to attend the schools of their choice, and it shouldn't necessarily be a nonprofit. However, the practicalities are that if we were to do this without having a separate pot of money, we would very substantially dilute the value of the TAG grants to the students that are receiving them to where they would really become almost meaningless. And so I applaud what you're doing and encourage you to go back and find a pot of money so that we can do this next year.
And Mr. Chairman, if I may, Senator Black, we're not sure how many students would apply for this. Let's say 1,000 students did. It wouldn't truly make it meaningless. It would reduce the value of the TAG grants to those students. And that's not the intent of this. The intent of this is to provide an equivalent to the TAG program for students, whether they choose, again, operative word choose, to go to a a private for-profit or a private not-for-profit. So, and it truly is a great workforce development initiative. Before the federal regulations that came down, I want to say it was 3 years ago, we didn't have this issue. A lot of the private for-profit institutions would provide their own grants. And under the last administration at the federal level, they actually took that ability away and penalized them and forced them to ensure that there was a portion, a large portion that was taken as student loans before the institution could provide any grant to the student. And it just kind of went catawampus on the entire process of the way it worked before. So we'll work on this over the summer. We'll come up with something good, and we'll make sure it doesn't degrade or reduce the existing TAG grant program.
Great. Without objection, Senate Bill 60 will be stricken from the docket. Thank you, Senator, for coming by.
Thank you.
Next up, Senator Favola, you had another bill. We did not let you go. I apologize. You were here,
okay.
and we just didn't let you go, and you had another bill before us.
That's okay, Mr. Chairman. It's Senate Bill 201.
And this bill, without objection, we'll set another 5-minute clock and look forward to hearing from you. Senator, thank you for coming.
Thank you, Mr. Chairman. What this bill does is it merely removes 2 sentences from the regulation section on hospitals, and it removes the 2 sentences that essentially require clinics that provide 5 or more abortions a month from the category of a hospital. So some of you may be familiar with the phrase TRAP, the Targeted Regulations Against Abortion Providers. This was the law that enabled those regulations to go into place. I want to remove these 2 sentences for 2 very important reasons. The abortion clinics here, or what we would say clinics that perform 5 or more first trimester abortions per month, these procedures are fairly safe, and yet we have decided to regulate these clinics as though they were hospitals. You have to juxtapose this against other procedures that we permit outside of hospitals that have a much higher rate of injuries or even death, such as colonoscopies. And yet, these abortions in the first trimester are 10 times safer than the outpatient services that we choose to not regulate as hospitals. I would submit that this regulation or this law was passed based on ideology, not on medical necessity. Many of you are aware that the Supreme Court ruling in Whole Health versus Hellerstadt came down and said that laws based in politics and ideology and not medicine are really intended to shame individuals. And this Supreme Court ruling stated that the TRAP-like regulations and TRAP-like laws actually pose an undue burden on a woman's ability to access abortions as defined under Roe versus Wade. So for these reasons, there are many others I can discuss. I merely ask that these 2 lines be removed so the state of Virginia can come into conformance with the rulings of the U.S. Supreme Court.
Great. Senator, thank you very much. Are there questions for the senator about the bill? If they're not, there are those that are come to speak in favor of the bill, and you'll just notice the clock. And then if you do have written testimony and you'd like to present that, feel free to do so. Welcome.
Good morning. I'm reading testimony on behalf of Dr. Nicole Calloway Rankins. I'm an OB-GYN physician who practices in Henrico County. I was born and raised in Virginia and went to medical school in Virginia. I trained to become an OB-GYN at Duke University Medical Center and hold a Master of Public Health degree from the University of North Carolina at Chapel Hill, where I completed a fellowship in clinical research. I'm writing to express my support of SB 201. This bill repeals medically unnecessary requirements for offices in which 5 or more abortions are provided per month. We all want women to have safe medical care. However, there is no evidence safety is improved by requiring these facilities to have the same standards meant for new hospitals. The U.S. Supreme Court agrees. The Virginia legislature should follow suit and repeal these medically unnecessary regulations that do not improve women's health or safety. Thank you for your time and consideration.
Great. Thank you for coming. Yes, welcome.
My name is Megan Kinkle. I'm a registered nurse from Annandale, and I'm reading on behalf of Alex Hillebrand. She is a resident of Arlington and a third-year medical student at Georgetown University. As someone who spent a lot of time in multiple medical clinics and hospitals, I can tell you the inside of an abortion clinic's patient exam room typically looks exactly the same as the inside of a pediatric clinic where your children get their vaccines. That's because a first trimester abortion is one of the safest medical procedures, far safer than getting your wisdom teeth out. Yet Virginia law specifically targets abortion clinics in a way that it does not target dental clinics. My patients deserve high quality medical care provided using timely and evidence-based practice. TRAP laws prevent timely care and they are not backed by medical science. The United States Supreme Court recognized this fact when they ruled TRAP laws are unconstitutional, and it's about time Virginia does the same. Thank you.
Thank you so much for coming and welcome. Yes, ma'am. Welcome. Thank you for coming.
I'm Rebecca Gottwald from Fairfax. I sent a recent. Many years ago, when I needed abortion care, I had to beg, borrow, and steal to obtain the funds to cover the cost of the procedure and the cost of travel, which was 120 miles to my nearest facility from my Southwest Virginia home. This was long before the TRAP laws were in place. These restrictions now lead to closures and more expenses, effectively barring many from exercising their constitutional right. I support Senator Favola in bringing the Commonwealth in line with the Supreme Court decision on whole women's health.
Welcome. Thank you, sir. Welcome back.
Hi. Again, I'm Aaron Goldberg with ACOG. We support this bill. It's an unnecessary regulation that obviously has ideological underpinnings, but hasn't kept a single patient safer.
Great. Thank you for coming. Yes, ma'am. Welcome.
Good morning. My name is Gail Dady. I'm with the ACLU of Virginia and a member of the Virginia Bar. I just wanted to clarify the holding of Whole Women's Health v. Hellerstedt is not, TRAP laws are not necessarily unconstitutional only if they are identical to the restrictions that were struck down in Texas. They are unconstitutional if they do not provide a medical benefit that is proven with evidence that outweighs the burden that they impose on access to abortion. It is our opinion at the ACLU of Virginia that Virginia's TRAP law would not pass constitutional muster under Whole Women's Health, and we urge you to pass this bill.
Great.
Thank you.
Thank you for coming. We've got about a minute and a half, so we're delighted to have you. Welcome. Yes, ma'am.
Hi, my name is Galina Varchana, again from near Alproches, Virginia, and of course we support this bill.
Great. Thank you for coming. Yes, ma'am. Welcome back.
Jennifer Allen with Planned Parenthood Advocates of Virginia. Mr. Chair and committee members, we support this bill and urge your support for repealing these unconstitutional restrictions. Thank you.
Thank you for coming today. Yes. Yes, ma'am. Hi.
Hello, my name is Alejandra Pablos, and I'm the field coordinator for the Virginia Latina Advocacy Network, and we also support this bill.
Great.
Thank you.
Thank you for coming today. Yes, sir. Welcome.
Scott Price, representing the Alliance for a Progressive Virginia, and we also support this bill for the reasons already stated.
Scott, thank you for coming. Yes, ma'am. Welcome.
Good morning, Anna Scholl with Progress Virginia. We do oppose any restrictions or regulations on abortion providers and abortion access that are not applied to like medical providers, and as such, we do support this legislation.
Great. Thank you for coming. Secretary Kerry, welcome back.
Thank you. On behalf of the administration, we support this bill. We do not see it as a justified, current state justified on the basis of quality or safety. Thank you.
Good. Secretary, thank you very much. Great. Are there those that are here to speak in opposition to Senate Bill 201? Yes, welcome.
Sure. Good morning, Mr. Chairman, members of the committee. I'm Chris Friend with the Family Foundation of Virginia. Despite the claims that our current law is unconstitutional, our own Attorney General advised the Board of Health that it had discretion in determining which standards currently in place are unconstitutional or not. And according to the Virginia Administrative Process Act, he could have simply said the standards were all unconstitutional on their face, but he didn't do that because he knows that the Texas case, while informative, did not strike down all standards across the nation. The industry claims that there's been no evidence that the standards are necessary, but as we have told you many times before, inspections found hundreds of health and safety violations throughout the abortion industry in Virginia. In fact, Terry McAuliffe's administration shut down one facility because of the gross violations that were found, and a facility the industry itself said should be shut down. But no one would have known about it without the standards, without the inspections, and that facility would still be operating if this law was not in place. Finally, the industry knows that the Virginia Board of Health and Department of Health are currently in litigation because in their zealous effort to water down the health and safety standards, they violated the Administrative Process Act over 20 times. It is very likely that a judge is going to overturn what the Board of Health did and reinstate these standards. They'd like you to do what the Board of Health failed to do legally. For those reasons, we would like you to vote no on this bill. Thank you.
Just for the audience, I failed to hit the clock in time, and so I've reset it at 3 minutes, not 5 minutes. It did take about a minute away, but if you don't mind still hanging in there, that'd be great.
Absolutely,
Thank
Senator,
you.
we'd be happy to. Again, I come before you not only on behalf of our BSHL's pro-life convictions that this law is unfortunately going to put women in harm's way, has put women in, the idea that we would not want women to have more guarantees in their health care provisions is ridiculous. I speak to you also as a woman who's had an abortion, who's worked for the last 35 years of my life with women who've had abortions. And I know from listening to them that we want more, not less, provisions for our safety and our care. My concern is always in the pro-life movement for women and their children. We see this as a violation of those protections. We hope that the committee will continue to maintain whatever standards we can under the current circumstances and climate to make sure that abortionists are not protected, but women are protected under Virginia code and Virginia law. I thank you for your attention, and I look forward to speaking to you again.
Great. Thank you for coming today. Yes, sir. Welcome.
Thank you, Mr. Chairman, members of the committee. Bill Ray with the Virginia Catholic Conference. We also oppose this bill, and I'd just like to echo the comments and opposition stated here today. Thank you.
Great. Okay, good. Senator Fowler, why don't you wrap up and tell us what you'd like to as we close out the comment.
Okay, thank you, Mr. Chairman. I will just say that depending on who's in the administration or what political persuasion or philosophical persuasion is prevalent in an administration, the regulations promulgated under this rule can be quite onerous. Our clinics have reduced in number from 21 to now 14, as I just checked with the Commissioner of Health 2 days ago. The kinds of regulations that have been promulgated under this law have included the number of parking spaces, the width of hallways, how many water fountains you can have and or should have, must have, is really the word I was looking for. I mean, there are a lot of physical requirements that mirror what hospitals must meet that are applied to these clinics. And they're onerous, it's expensive, they require renovations. Clinics frequently have to raise capital dollars to meet these requirements. And in effect, it forces the clinics to close. So, and I want to say that these clinics, although they may perform 5 or more first trimester abortions, also provide a lot of services that are very, very necessary and address the preventive and primary care of women and families. A lot of our cancer screenings, pap smears, vaccinations, immunizations, a number of services that our children and families need to stay healthy. And I think this is an access to care issue as well. To have parts of our Commonwealth where an individual has to drive 30 or 40 miles to receive care, I think is unconscionable. So please permit our clinics to survive, to flourish, to serve our families, our women and children, and remove this onerous requirement. Please, this has nothing to do with medical necessity. It is really based on ideology. Thank you.
Thank you very much. Senator Chase.
Thank you, Mr. Chairman. Senator Favola, just a quick comment on this. I actually attended the the Department of Health's hearing where they were talking about regulations that were supposed to comply with the laws that the General Assembly had passed. And I know that there were a number of constituents of mine that showed up at that meeting because they were very upset that the regulations that were being taken out of what the General Assembly had passed. In other words, at that particular time, we had a governor in place that passed regulation that would tighten these requirements, and it was under Dr. Levine, who was there, and his board. They actually relaxed those regulations. So whenever you say we're tightening these regulations, I really take issue with that because that is not what happened. And I was the only legislator at that meeting, and I will tell you that that is not the case. They're more relaxed because this administration has relaxed those regulations. And so I take issue with your statement. I would also say that this issue is not about I think some of the people here, I mean, I know all the people here mean very well by what they're trying to do, but I think we need to look at the language of the bill. The language of the bill says, for purpose, this is what we're trying to take out of this bill. It says, for purpose of this paragraph, facilities in which 5 or more first trimester abortions per month are performed shall be classified as a category of hospital. Whether I support, whether I'm pro-life, whether I'm pro, if you want to call it pro-choice, I wouldn't go to any other doctor if they were a dentist if they only performed 5 operations a month in a facility, no matter what type of physician I went to, no matter whether it's a cardiologist. We could talk to our cardiologist. If he only performed 5 heart operations, I would have a serious hard time in going to his particular facility for heart surgery. And I think this is a safety regulation to protect our women, to protect our young women. I'm a mom of a 21-year-old daughter, and if my daughter ended up in a situation and made this choice, I would want to make sure that that facility had at least performed that procedure at least 5 times a month as a minimum qualification. That's what this is. This is not a pro-life versus pro-choice bill. And those of you who are in support of this need to read the language. Thank you.
All right, Senator Black.
Thank you, Mr. Chairman. From the very earliest days when the debate over abortion commenced, one of the strongest arguments was that we did not want to have back alley procedures. We wanted to have women treated in a dignified way, and that there would be standards for sanitation, for various other things. And I think that the regulations governing hospitals that were passed, whether one favors abortion or does not, they simply established standards whereby if the procedure is going to be carried out, it will be done in a dignified and safe fashion where women will have the same standards that they would have in a hospital, even if they're disabled. There have to be provisions for disabled citizens also. And so I think it's very important that we do have these regulations so that we don't go back to the types of abortions that were so vociferously argued against back in 1973 when Roe versus Wade was approved by the Supreme Court. I think we do need to have the sanitation, we do need to have the safety regulations, and so I do oppose this bill.
Great. Are there motions on the bill?
I move to report.
There's a motion and a second that the bill be reported. All those in favor?
Mr. Chairman, substitute motion.
Well, we're going to get to that, I think. So all those in favor of reporting the bill will record their votes aye. Those that are opposed to the bill will record their vote no. Have everyone voted? Clerk will close the roll.
Yeas 7, nays 8.
All right, the bill fails to report. Is there another motion on the bill?
Move to PBI.
Second.
All right, clear the vote. So the motion is shall the bill be passed by indefinitely? All those in favor record their votes aye. Those opposed, no. Clerk will close the roll.
Thank you, Mr. Chairman.
Yeas 8, nays 7.
The bill fails to report. Thank you, Senator, for coming by to see us today. Up next is Senator Servell. Senator Servell, you have your Senate Bill 245 left before us. Welcome, sir.
Thank you, Mr. Chairman, members of the committee. I'm not sure that the full committee has actually heard this bill before. I know it was heard in subcommittee about 2 years ago, but this legislation has to do with conversion therapy, what's called the conversion therapy. And just, Mr. Chairman, first of all, as a, I guess, an administrative matter, to conform my bill with Delegate Hope's bill in the House, I was hoping to make one quick change, which is to change the title and the definition of conversion therapy to sexual orientation change efforts.
All right, well, the clerk, does the clerk understand the amendment? If so, you can report the amendment?
Mr. Chairman, can Senator Serval repeat that?
Sure. If you just look on the title on line 13 and on line 14, replacing the words conversion therapy with sexual orientation change efforts. That would conform my bill to the bill that's on the other side.
Okay, well, I think we've heard it, and I think we've got it. Thank you. All those in favor of the motion for the amendment will say aye. Aye. Opposed, no. And the amendment's agreed to. Senator, thank you for coming in. With your consent and the consent of the committee, we'll put a 5-minute clock on this one as well. Go.
Got it. Thank you, Mr. Chairman. Conversion therapy basically is the practice of trying to give a child therapy to convince them that they are not gay. The legislation is drafted prohibits a licensed Virginia psychotherapist from engaging in this kind of practice, but only as to children. Does not have anything to do with an adult wants to make that choice, only if this is being done to a child. Really quick, I'm going to talk about the lack of medical support, the evidence that this kind of practice is harmful, which has been validated. And lastly, I'm going to talk about what this bill does not do. First of all, in 1973, the American Psychiatric Association declassified homosexuality as a mental illness. Before then, it was classified that way, and since 1973, it is not. They also, just so we're clear where this practice came from, before 1981, techniques that were used to convert people from not being from homosexuality included things like ice pick lobotomies, chemical castration, hormonal treatments, electric shock, nausea-inducing drugs, and things like that. I'm not going to get into the specific details in light of the children present, but there were a lot of things that used to happen that now are no longer done. Instead, what's done are these type of so-called counseling involving counseling and videos and other things, which are very harmful. Existing research has shown that when a family tries to engage in this behavior to convince a child that they are not homosexual, that children are 8 more times likely to commit suicide, 6 times more likely to report depression, 3 times more likely to use illegal drugs, and 3 times more likely to be at high risk for HIV contraction. This type of legislation prohibiting this has been passed in almost 10 other states, 9 other states so far. It's been upheld by the courts. There's been juries which have found licensed professionals guilty of malpractice for engaging in this for children. So the world out there has been condemning this across the country. The American Psychiatric Association has labeled it unethical since 1998. In 2001, President Bush, as the Surgeon General, said that there was absolutely no scientific support to support the idea that sexual orientation can be changed. The practice has been condemned by the American Counseling Association, the National Association of Social Workers, the American Academy of Pediatrics, the American Association for Marriage and Family Therapy. It's just not supported by any professional organization whatsoever. The last thing I just want to make clear is what the bill does not do. The bill does not prohibit, again, anything involving an adult. If an adult wants to choose to have this kind of therapy, they can have it. What this seeks to do is protect children, number one. Number two, it does not prohibit alternative treatments for youth who are conflicted about their sexual orientation and identity and would like to get counseling about that. So it does not prohibit that type of counseling. And it does not prohibit pastoral counseling services provided by religious or faith officials. It only applies to licensed professionals. Having said that, I'm sorry, and also the legislation that's been passed in other states has been signed by 4 GOP governors, 4 Republican governors. So there's been bipartisan support for this across the country, the idea of legislatively doing something about this. I'm happy to answer any questions. I know there's a lot of people here to testify about it.
Senator Carrico.
What if a pastor's a licensed clinician?
If the pastor's a licensed clinician, I guess it would depend in what capacity they're doing that. Whether or not they're doing it for free as part of their pastoral counseling or whether they're getting paid.
If he's licensed
Senator
and I'm a member of his congregation and I want to take my child to him.
And he's licensed and it'd be doing it in his office where he's getting paid for it? I would think that his
Well,
licensing regulations would kick in as opposed to doing it as part of
But
his
he'd be
capacity as a
prohibited,
pastor.
or he could be charged if he were to counsel.
I'm not sure. Mr. Chairman. Right.
Okay, we're good. Senator Carrico, does that complete your question?
No,
sir?
he had a question about whether it could be charged.
Oh, go ahead.
That was my question.
Right. It's too bad Senator Donovan's not here, but I don't think this creates a crime necessarily. It has a prohibition, and so I think there potentially could be a licensing consequence. I don't know what kind of licensing proceeding they would do in that situation, but if the person did it as part of their professional practice, and maybe somebody from the Department of Health could answer that, but if it was being done as part of a paid service they were doing, I would think the licensing would kick in. But if it was done as a pastor, that's, again, outside of this.
Okay.
Mr. Chairman.
All right, so next up is Senator Black. Question to the patron.
I have a question that has always troubled me with this whole area, and that is really, it goes to the First Amendment. And I don't understand how we instruct people not to make a certain argument, whether they're a therapist or who they are, not to make a certain argument without violating the First Amendment. For example, you and I might argue the merits of this issue. I would never suggest that you shouldn't be able to argue your side, and I don't think you would argue that I shouldn't be able to argue mine. And now I understand with some of the things you're talking about, the castration, things of that sort, no question there. But when we're talking, whether it is a pastor or whether it's a psychologist or psychiatrist who feels that there is a means of persuasion, I don't know how we get around the First Amendment. I don't know how we prevent damaging the First Amendment whenever we tell people there are certain arguments that you may not make.
Right. Mr. Chairman, can I address that? Go ahead. Thank you. So what I would say to the gentleman, Mr. Chairman, is that, first of all, this doesn't apply to pastors. Again, potentially if they're licensed and it's in their office as part of getting paid to perform a service, that's one thing. But if it's pastoral counseling services that are being done through the church, that's religious counseling. So number one, I don't think that's covered by this. And I can understand the gentleman from Grayson, Senator from Grayson's potential scenario there. But with regard to doctors and the First Amendment is not absolute. If speech causes harm, it can be legally actionable, either criminally or civilly, whether it's defamatory or whether it's other types of speech which causes harm. There's all kinds of speech that we regulate, both professionally. There's certain things doctors can't say and can be sued for, and if they do, there'll be consequences. So,
because of time, Senator Peake, why don't you go, and then we're going to hear from some that are supporting.
Mr. Chairman, Senator Sorvell, quick question. You cited some statistics, percentages of higher suicide, higher depression.
Right.
And is that based against gay juveniles who do not go through conversion therapy, or is that the juvenile population in general?
This is, first of all, that's research that I pulled 2 years ago when I presented this, and my recollection is that it's research about gay children who are not accepted by their family. There's an article I was just looking at a few minutes ago that was in the Journal of Medical Regulation, which was published in 1996, which indicated that conversion therapy is associated with higher risk of suicidal ideation, depression, and drug abuse, but I couldn't click through the footnotes to get to the end of it to figure out precisely what it was saying.
Thank you. All right. Very good. Senator, thank you. And with those that are here to speak in favor of Senate Bill 245, stand forward, and we will put a clock on both sides of this. Welcome back, sir.
Thank you. Mr. Chairman, I'm Scott Price. I represent the Alliance for a Progressive Virginia. And I didn't bring my glasses, so bear with me. We have a lot of witnesses, and I'll be out of your way in a moment. I want to thank the senator for bringing this bill back. I want to point out that the state has a responsibility when it licenses a practitioner to stand by what that practitioner does and says. So it's not a First Amendment issue. If I say I'm a licensed practitioner in the state of Virginia and I can cure your child of being gay, that's not appropriate, and it's not a free speech issue because being gay is not an illness. So I want to get that across, and clearly, that's what this bill does. It's a simple thing that protects children. I'm going to get out of the way and let some more witnesses talk.
Thanks, Scott. Welcome. Yes, ma'am.
Good morning. My name is Deborah Hawkins, and I also forgot my glasses, so forgive me if I read this kind of close. But I'm a family therapist and a resident of Chesterfield County, and I urge you to pass this bill. Some of you might think that this bill would deny youth counseling about unwanted same-sex attraction. It does not. What it would prohibit is counseling using a treatment philosophy and interventions which delay effective evidence-based treatment and are psychologically damaging and harmful. As responsible adults, we often limit certain practices because youth and even their parents might want something doesn't mean it should be legal. For example, if a parent thinks their child could drive responsibly at age 14, it doesn't mean we still don't say that's not safe. Or if a parent smoked and thought their kids could smoke, we're not going to go and legalize smoking for minors. This bill is necessary to emphasize that we do not want an unethical, harmful practice of the past to continue. As professionals, we know effective evidence-based treatments that meet a certain quality standard of care, and conversion therapy does not. It's time to codify that Virginia rejects conversion therapy for minors. Thank you.
Great. Thank you. Yes, welcome. If you have written comments you want to present to us, we'll take those. Welcome. Yes, sir.
Mr. Chairman, David Brown, Director of the Department of Health Professions, and the administration supports this bill.
Great. Thank you for coming. Yes, ma'am. Welcome.
Mr. Chairman, Lindsay Walton with Macaulay and Jamerson, representing the Virginia chapter of the National Alliance on Mental Illness, and we support this bill.
Great. Thanks for coming. Yes, sir. Welcome.
Good morning, Mr. Chairman, members of the committee. I'm Roland Winston. I'm the chair of the Advocacy Committee for the Gay, Lesbian, Straight Education Network, which does education work for the community, and I'm also the executive director of Mothers and Others, which does advocacy for the community. Comments from Sam Brenton, who is the Policy and Governmental Affairs Director for the Trevor Project, were submitted to the members overnight by email, so don't have any printed to hand out. We support the bill.
Great. Thanks for coming. Yes, sir. Welcome. We have about 2 minutes left. Welcome. Yes, sir.
Yeah, my name's Alex Wilson. I'm a licensed clinical social worker since 1991. Been a member of the National Association of Social Workers, the NASW, for 30 years. In the year 2000, the NASW released a statement that said, I quote, "No data demonstrates that reparative or conversion therapies are effective." It's as simple as that. The state has a compelling interest in ensuring that licensed healthcare providers follow professional standards of care and do not engage in dangerous practice that have no scientific basis and put clients at risk. Thank you for listening, and thanks for supporting.
Thank you very much. Good. Yes, ma'am.
Hi,
Welcome.
good afternoon. Amy Canova, nationally certified school psychologist. SB 245 would ensure that mental health providers who have somehow missed the memo for the last 50 years understand that it is unacceptable, unethical, and irresponsible to attempt to change someone's sexual identity or gender expression under the guise of therapy. They will no longer be allowed to fool parents into thinking that conversion therapy is good for kids. All too often, parents who have their children's best interests at heart are coerced into sending kids to reparative therapists who are practicing fraud and endangering the lives of young people. As a Commonwealth, we need to recognize the need to provide appropriate therapies that provide empirically based acceptance, support, and understanding of LGBT youth. Thank you.
Great. Thank you very much. I know some people in the back are concerned, so just...
Morning,
Yep.
Gail Dady with the ACLU of Virginia. I'm sure you're all familiar with our work defending the First Amendment. We support this bill.
Thank you for coming back. Yes. Yes, sir.
Mark Lowen, licensed professional counselor in Virginia and owner of a big group practice in Richmond. We support this bill.
Thanks for coming. Yes, sir.
Joshua Brooks, I'm a licensed professional counselor and a member of the American Counseling Association. I support this bill.
Good. Thank you. Yes. Hi.
Hi, I'm with Equality
You're
of Virginia,
supportive?
and we support this bill for the reasons stated.
Great. And thank you for coming. Yes. Hey, welcome back.
Thank you, Jennifer Allen, Planned Parenthood Advocates. We support this bill on behalf of our LGBTQ patients across the Commonwealth.
Great. Thanks for your help. Thank you. You just want to say you also support?
Yes, but I was personally not as near out. I've had friends who
Oh,
committed suicide.
well, we appreciate you coming. Thank you very much. With that,
Mr. Chair?
Yes.
I want to ask a question of the patron.
Sure.
And I appreciate all the people that have spoken, and this is an important issue, but if you actually read the bill, one of the things that sort of concerns me is, let's say somebody comes into I'm not a psychologist and I don't play one on TV, but let's say a teenager comes into my office and that person is what we would call in a different era promiscuous with somebody of the opposite sex. And you say as a psychologist, you should stop having sex with that person of the opposite sex. That's clearly not covered by this because you're not reducing their urging towards a member of the opposite sex. Now, what if they come in the same situation and they're having sex with somebody of the same sex? And now you say you should stop having that relationship. Are they now in violation of the statute?
No, not at all. That doesn't cover this. This only covers counseling that's intended to change your orientation, not prevent you from engaging in sex. That's totally.
Well, it says
appropriate counseling.
or to eliminate or
Senator
reduce
Peterson.
sexual or romantic attractions or feelings. I mean, that's or.
Where are you? What line are you on?
Well, it says or to eliminate or reduce sexual or romantic attractions or feelings towards individuals of the same gender.
I think that relates to in general and not to a specific person.
Well, I guess
Senator Peterson.
my point is, and listen, I don't support conversion therapy, but this bill's pretty broad. And, if you counsel someone towards abstinence, I mean, unless it's abstinence in a heterosexual relationship, in which case you're not covered.
Yeah, all I can tell the gentleman is at least, the people I've been speaking with about this made it very clear to me that it's not their perception that it would not be interpreted that way by the licensing authorities. And they're here, Mr. Roberts is here to probably address that question better than I can, but I don't think they view it that way either.
Well, let me just, if I might, Mr. Chair, and I don't want to beat a dead horse, but listen, I know that these are social issues and you're just supposed to vote and not actually read the legislation, but if you read the legislation, I mean, is abstinence covered by this or not?
Here's a professional. He probably answer the question better than I can.
Hi, I am a counselor. As a therapist or a psychologist, it is never the role to tell a client what to do or what not to do. So it is actually not the role of a therapist to advocate for abstinence or not abstinence. It's the role of the therapist to look at what the goals are for the client and what's going to help them from their perspective and help them get there. But conversion therapy already sets that goal. And it, before the client even comes
I don't
in,
mean to
already
cut you off.
says,
I understand, maybe, can I
says
talk,
that.
Mr. Brown?
Okay.
Mr. Chairman, very briefly.
Are you here to answer his
Yes.
question? Okay.
David Brown addressing the question from Senator Peterson. I think the boards in question have a clear understanding of what conversion therapy is, and I think I don't think your hypothetical would apply. That's based on the conversations. I know these boards have discussed conversion therapy, and
I'll make one more.
Senator Peterson.
And then I'll shut up.
Nope.
And I'm going to vote for Scott's bill, but if this gets through, this needs to be cleaned up because it's just too broad right now. The language is broader than just conversion therapy, in my opinion.
Okay. Senator
Mr.
Carrico.
Chairman.
Just real quick for Dr. Brown. So if I'm a licensed counselor and I'm not being paid, but yet I have these conversations with a family member that asks me to have it with the child, can I not be reported right now and lose my license?
if you're a licensed counselor, someone can make a complaint against you for whatever reason.
And you're going to investigate?
And it will be investigated.
Thank you.
Senator Donovan.
Mr. Chairman, and for Dr. Brown as well. That's my point. Having served on the Board of Medicine, we have an entire board of subject matter experts that hear these kinds of things. Conversion therapy is clearly not approved therapy in the clinical community now. So why are we codifying an arena of the board when we have entrusted subject matter experts to discern those matters individually as clinical practice changes? I guess maybe I was an assertion. I apologize.
Good. Thank you. Senator Peake, you have a question, sir? Okay. Very good. So, Scott, if it's okay, we're going to go to the side where those that struggle with the bill, and you also will have 5 minutes. You don't have to take it all, but welcome to hear.
I'll try not to. Thank you. Mr. Chairman, members of the committee, Chris Friend of the Family Foundation. For those of you who are on the subcommittee that heard testimony on this bill 2 years ago, you may remember John. John came and told his story of having once had struggling with same-sex attraction, but had received counseling and no longer had that struggle. Unfortunately, he couldn't be here today to testify because he's over at MCV attending to his wife, who is very sick. Note that I said his wife. He is happily married, leading a very, very productive life, and wanted to be here today to stand before you to show you that such people actually exist. There are people who have had unwanted same-sex attraction that no longer do so because of counseling or therapy. Some people refuse to recognize the existence of these people. John wanted to be here to show you that they do exist, and there are thousands of them. This legislation is dangerous in several ways. First, despite the assurances that this doesn't apply to those who have unwanted same-sex attraction, I read the bill over and over again. I do not see a caveat for that. This is a broad bill that I do believe will prevent those who have unwanted same-sex attraction from getting counseling. It violates Virginia state law that says that a parent has a fundamental right to direct the care of their children. And finally, as been pointed out, we have a board of counseling that licenses, that complaints can go through. And if there are people who believe that something has been done that should be questioned, that's what the board is for. So for those reasons, we encourage you to vote against this bill. Thank you.
Thanks for being here today. Yes, sir. Welcome back.
Eddie Ayla, Virginia Assembly Independent Baptist. I had a pastor in our group who's a licensed counselor who had to stop, and that was part of his way of earning income because it was a small church. And he literally, because of pressures, because while people may not accept this, this is a very subjective area. Counseling is very subjective. And if we go back in the history of Virginia and the United States back in the early 1900s, there was a move to sterilize certain individuals because they thought that was in the best interest of society and those people. And what happened is we ended up having to give reparations to those individuals for that great error in judgment, and I hope we don't move the direction now. Thank you.
All right. Yes, you want to pause?
In the last century, it went on until 1971.
Okay. Thank you, Senator Saslaw, and we will begin again. You have about
people who we thought were mentally deficient.
Yes, that's right.
Whatever the hell that means.
Thank you. You have about 2 minutes left. Welcome.
Bill Ray with the Virginia Catholic Conference. Most of the points I was going to make have already been made, so I'll be brief. We do have concerns that this could affect clergy if they are also licensed psychologists, or licensed therapists, rather. Also the concerns about the broadness of the language. If it does prohibit anything that would reduce romantic attractions or feelings, this could prohibit simple counseling to chastity. Also, the enactment clause at the end is somewhat worrisome. It prevents the state from authorizing a grant or a contract with any entity that would even refer for this. So there's additional concerns if someone were to hand a list of therapists to someone and one of those therapists ended up performing something that would fall under this overly broad language, that could jeopardize grants and contracts. So we just have a number of concerns about the scope of this bill and would encourage you to oppose it. Thank you.
Great. Anyone else here speak in opposition to the bill? Okay. Senator Black.
Yes, thank you, Mr. Chairman. I'd just like to make a comment. I just looked up as we were talking. There's Dr. Robert Spitzer, a psychiatry professor at Columbia University, who began his study on conversion therapy as a skeptic. He did not believe that it was something that worked, and yet his analysis indicated that of 143 men, 57 women who said that they had these same-sex attractions, that there were a substantial number who had achieved a very smooth heterosexual functionality. And I just point that out because I have seen dozens and dozens and dozens of similar studies, and it sort of goes back to the First Amendment. I have, not just with this bill, but with many things, I really am very uneasy with the idea that we instruct people that they cannot express their beliefs, their opinions, even though those opinions may be difficult for other people to accept. And we've seen psychiatry. If you go back to the DSM-4 from years and years ago, it said things that were radically different than today. And so the idea that you would just simply say, well, we're going to fix it in place and we're going to make it unchangeable forever. I think that these are matters of opinion, and I think that reasonable people should be able to express their opinion. If somebody does not like that type of therapy, they are quite free in our marketplace to say, I don't like what you're doing, and I'm going to go to somebody else who will take a different approach. So.
Great. Senator Black, thank you very much.
Mr. Chairman.
Yeah, Senator Howe.
I would just like to point out that we're talking here about children. We're just saying that children cannot be subjected to this therapy. If any adult wants it, it doesn't impact them at all.
Great. Any other comments by committee members? Scott, why don't you just sum up real quickly, and then we'll take a vote. Thank you.
Yeah, I think everybody's distracted by this emergency alert on the screen, but
Jonathan says it's okay.
Okay. It's nobody let it match. Mr. Chairman, I just would point out again that virtually, I'm not aware of any professional organization engaged in any kind of psychological, psychiatric counseling which says this is an approved practice. I've listed them out. It's been rejected, as you heard, for a long time. The APA, in 2009, the American Psychological Association issued a report, speaking to the gentleman from Lynchburg, Senator from Lynchburg's question, that they found the harms associated with conversion therapy include anxiety, depression, suicidality, guilt, helplessness, hopelessness, shame, social withdrawal, substance abuse, stress, self-blame, decreased self-esteem, increased self-hatred, problems in behaviors, high-risk sexual behaviors, deterioration in relationships with family. And that's if people do this. We're talking about children. Children don't have a choice. We heard testimony 2 years ago from people who had been through this, who had tried to commit suicide. We heard testimony 2 years ago from families who said they'd been duped into doing this and they didn't like it. And I think we really ought to step in.
Okay. Scott, thank you very much. Is there any other committee member have any comments? Senator Chase.
Mic on here. Thank you. Senator Sarvel, I guess the question I had is, where are the parents in this situation? We're talking about children that are 18 years and under. I'm just curious, where are the parents in this situation making those decisions for the kids?
I'm not sure I completely understand your question, because
The parents have a say, is basically what she's saying. I mean, you're saying that you can't do it
Correct.
no matter what the parents say. Is that correct?
That's correct, and there's lots of different things like that where we tell parents they can't do it. You heard of several listed, including allowing your kid to smoke or drink or engage in other kinds of behaviors which are harmful to children, which we've deemed are harmful to children. Actually, you could let your kid drink, I think, but but smoking, I think, has been prohibited. And obviously, I don't think you could sanction any kind of medical procedure for your child, which would be harmful to the child. I don't think any doctor would do it. It's probably illegal.
Okay. Any other question? Senator Sarvel, I appreciate you coming forward, and as always, a very succinct presentation. Senator, I think we could come to an agreement on some conversion therapy as it used to mean, which is a lot of terrible things. Honestly, there's the chemical castration, the some of the shock therapy, some really tough things. Maybe we can work on that. There is this entire question about whether it reaches into the parents and the pastor's role. And so I think that's kind of the struggle. It's not disrespect to your position and your presentation here that is of a little bit of concern, but I thank you for coming. So, is there a motion on the bill?
Move to report.
There's a motion to report, and there's a substitute motion to, there's a motion to PBI, and then there's a substitute motion to report. Therefore, the primary motion is that we report the bill. All those in favor of reporting the bill will record their votes aye. Those opposed, no. The clerk will close the roll.
Yea 7, nays 8.
Okay. Yeas 7, nays 8, and the bill does not report. And then the underlying motion is the bill be PBI'd. All those in favor of the bill will clear the board. Okay. All those in favor of PBI and the bill record their votes aye. Those opposed, no. Clerk will close the roll.
Yea 8, nays 7.
The bill is passed by indefinitely by an 8-7 vote. Scott, thanks for
Thank you.
coming.
Appreciate the committee's time and the discussion. Thank you.
Yes, sir. Thank you. All right, up next, we have Senator Dance and then Senator Marsden. Is Senator Dance here? Senator Dance, you have before us one bill. So welcome. You want to present your bill?
Yes, thank you. I don't know if I should say now or later, but
Yeah.
Senator
Mr. Chairman.
Ruff, yeah.
Mr. Chairman.
Yes,
Senator Ruff asked if he could roll his bill into Senator Dance's bill and be co-patron.
Yes.
Okay. There's a motion and a second that we roll Senator Ruff's bill into Senator Dance's bill. All those in favor will say aye. Opposed, no, and the bill is rolled. Senator Dance, you now have 305 before us. You want to present that bill?
Yes, Mr. Chairman, this bill directs the Virginia Department of Health in partnership with the Virginia Alzheimer's Disease and Related Disorders Commission, the Virginia Department for Aging and Rehabilitation Services, and the Alzheimer's Association to incorporate in its existing relevant public health outreach programs information to educate healthcare providers on the importance of early detection and timely diagnosis of cognitive impairment, validated cognitive assessment tools, the value of a Medicare annual wellness visit for cognitive health, and the new Medicare Planning Billing Code 99483 for individuals with cognitive impairment, and it allows them to let them know that they can get reimbursed for doing this. This is a good thing, but it is now covered under Medicare. Encouraging them to increase understanding and awareness of every warning sign of Alzheimer's disease and other types of dementia, the value of early detection and diagnosis, and how to reduce the risk of cognitive decline, particularly among persons in diverse communities who are at greater risk of developing Alzheimer's disease and other types of dementia. What it is adding Alzheimer's to a list that's already there. It's not an added expense. It's just ensuring that as we educate, we understand the importance of Alzheimer's. You know that some of us seasoned people might have not been here today to experience the effects of dementia and Alzheimer's because we've been long gone. But because we're seasoned and living so long, we're experiencing this. But early detection could prevent us as far as the on-site and there are different things that we can do to slow down the process, if you will. I have Carter Harrison from the Alzheimer's Association to speak in support of this bill.
Great. Senator, well done. Are there those that have a question for the patron? If not, welcome. We'll allow you to speak. We're going to put a timer. I don't think you'll need it, but we'll put it up there.
My name is Carter Harrison with the Alzheimer's Association. We asked Senator Dance to put the bill in for us. We're looking forward to working with the health department to get this information out in a new way. Reason for the bill, this is not usually typically considered a public health issue, and it has become more of one as we've been moving forward. So we want to make sure that we get that front and center. So, Mr. Chairman, thank you. I'm happy to answer any questions.
Okay, any questions? I think, unless I'm not hearing something, I think we're in good shape, aren't we, Senator Peake? So is there a motion on the bill? There's a motion and a second that we report Senate Bill 305 and include in it Senator Ruff's bill and have them both as a chief patron. All those in favor of the bill will record their votes aye. Those opposed, no. Clerk, close the roll.
Thank you, Mr. Chair.
Yeas 15, nays 0.
Yeas 15, noes 0, and the bill is reported. Senator McClellan, to the staff, indicated that when we had a PBI vote a little while back, that it was on the board as a report vote, and maybe if the clerks can kind of work with her on that to make sure that we did what we thought we did. You fixed that? Well done. Thank you. Okay, up next is Senator Marston. Senator Marston, you have two bills before us really related to the same subject matter. Is that reasonable to say?
Subject matter, two different categories of individuals that would be impacted.
Would you mind if we, and I won't if you say no, but would you mind if we heard testimony together on them because they're similar enough? Is that okay with you, sir?
That's fine. I'll present both of the bills. I'd like to start with 810, and there is an amendment to 279 that I turned into the clerk earlier. And is that ready for distribution also? When
clerk will report amendment.
And that's on two.
On
the other
Senate Bill 237. Thank you, Mr. Chairman. Senator Marston. The amendment strikes all the language.
Tom, let me just wait just a second. We're on 810 from a
well,
functional
we'll start
standpoint.
with 8. We'll do the amendment then.
Yeah, and then
when
maybe
we
we can get to the
other
amendment
bill.
on the other bill in a moment.
Okay,
Is that okay?
that's
All right.
great. Thank you, Mr.
Thank
Chairman. Senate Bill 810 deals with the eligibility for in-state tuition for certain individuals, immigrants, who have applied for permanent residency in the United States. These folks are on temporary protected status, so they're here lawfully. An example of that might be political asylum, some kind of refugee status. There's 3 conditions that have to be met. They have to have graduated from a public or private high school in Virginia. They can submit evidence that they or a parent or guardian has filed Virginia income tax returns for at least 1 year prior to the date of registration or enrollment, and that they are registered as an entering student in an institution, in a public institution of higher education. This measure recognizes that the status quo needs to be reformed by granting aspiring children the means to continue their education and improve our education system in the Commonwealth. Overall enrollment growth at Virginia's public 4-year colleges has slowed in recent years, and enrollment has fallen at Virginia's public community colleges, where at least most DACA, or delayed action on childhood arrivals, DACA children have approved students for enrollment. Consequently, new enrollments would be welcomed. Virginia is required to invest in elementary and secondary education for undocumented children, but can't collect as much on the return once they leave the public education system. In other words, Mr. Chairman, we are investing in young people whose potential we may never realize because we're paying for that we have to educate them as elementary school students and high school students, but are unable to assist them in getting their 4-year and 2-year degrees. The increased estimate in the productivity that these individuals, as they get through their higher education, could contribute to the Commonwealth of Virginia's $280,000. Providing an in-state tuition to children educated in the Commonwealth pays dividends by reducing the dropout rate, leading to substantial savings in criminal justice costs, and sharply increasing the taxes paid by those benefiting from this initiative. These young people will continue to be with us for some time. I think it is to our benefit that they be educated, hopeful, and productive. And that is the bill, Mr. Chairman. And it does deal with those who are here lawfully. And certainly any change in status indicated by the federal government would negate this. But at this time, they're here. Let's get them educated. Let's get them productive.
Great.
Mr. Chair.
Senator, thank you very much. Yes, Senator Peterson.
This is a friendly question, but this makes them eligible, and I've read through this criteria, it makes them eligible for in-state tuition. Would these be students that would otherwise qualify for in-state tuition? Because obviously getting in-state tuition is always a competitive, and you get a lot of people unhappy when they don't get in-state tuition.
They basically have to abide by the same rules.
So they would still have to qualify under all the same criteria that George Mason or whomever would look at? Okay.
Great. Thank you. Senator, well done. It is a different look, and it is a different subgroup of individuals. We're grateful for that. You want to tell us about now also your other bill, which is Senate Bill 237, we're going to vote on them separately because they're different subject matter, different groups, and then we'll entertain an amendment on that bill as well, and have a public hearing, and then we'll vote.
Yes, thank you, Mr. Chairman. And the amendment was proposed by the Attorney General's office. I'm sorry it came in too late for a formal substitute, but I do have the Attorney General's office here to explain the amendment.
Great. So, Tom, can you report the amendment?
Thank you, Mr. Chairman. Strike the new language, starting with absent congressional intent on lines 24 through 27. Then going back to line 20, insert or any individual currently granted deferred action by ICE absent congressional intent to the contrary.
Okay. Mr. Chairman, if I could have the representative from the Attorney General's office explain the amendment which fixes some language errors that we had.
Perfect. Thank you. Welcome.
Good morning. I'm Elizabeth Griffin from the Office of the Attorney General, here to speak on Senate Bill 237. As the Senator stated, we did propose this amendment, and the reason that we proposed the amendment is that the bill is introduced while well-intentioned, would have had the unintended consequence of extending in-state tuition eligibility to DACA students who weren't from Virginia. And that was just a drafting issue. So the proposed language, again, would say that those students who are under the Deferred Action for Childhood Arrivals program are eligible to establish domicile just like other students from Virginia. And to do that, they would have to go through the factor analysis like other students who are applying for in-state tuition in Virginia.
Great. We're so grateful that you caught it and that you fixed it. The amendment is before us. Is there a motion on the amendment? There's a motion and a second that the amendment be agreed to. All those in favor say aye. Opposed, no, and the amendment's agreed to. Senator, let's hear from the public about your bills. They are different subject matter, but
if I could just briefly
I didn't
address the DACA. This is in-state tuition for DACA students. These are kids in different categories. These are the deferred action childhood arrivals. These are folks who are not here on political asylum or are not here on green cards. These are kids who were brought here as infants, brought here as young children where they had no choice. This is the only country they know. Perhaps English is the only language that they understand. And in 2016-17 school year, there were over 12,000 DACA recipients in Virginia. An estimated 1,200 have been able to enroll in Virginia's institutions of higher education due to Attorney General Mark Herring's legal opinion. In 2014, he determined that DACA students had the capacity to intend to remain in the Commonwealth of Virginia indefinitely. So this essentially is codifying what is already the practice here in the Commonwealth. It concerns that eligible students would overwhelm the public system of higher education do not appear to be the case. This bill will actually bring increased business activity and will enhance state revenue, not increase costs, as some might believe. Currently, many students are economically barred from access to higher education because they are not eligible for federal financial aid as well as many scholarships. Upon passage, Virginia public colleges will receive new tuition payments from these students who are currently not enrolled and increase lifetime earnings and far exceed the cost to the college and the state. There are currently 27,000 job vacancies in Virginia requiring an associate's degree or higher, and over 18,000 of those requiring a bachelor's degree. We should not turn away talented, motivated students willing to work hard and succeed. Immigration status should not be rationale for throwing away the investment we've made in these young people. An educated workforce will help the Commonwealth stay competitive in the global knowledge economy. Just to sum up, in both of these cases, Mr. Chairman, these kids are going to be here. Congress may arrive at a DACA solution. These folks who were here on political asylum may be here for years and years and years. Let's get them educated. Let's make sure that once these things are settled and they become American citizens, they're not so far behind the 8 ball that they can't compete and they can't succeed in America. That's what this country's all about. And until the federal government make changes in the rules, which is certainly something that they can do at their discretion, that's why we have a federal Congress, let's act as though these kids need us now, and let's come to their assistance. Thank you.
Senator Marston, well done. Are there those that are here to speak in favor of these bills? I know that we're going to vote separately on, or maybe actually different votes on them. But Senator Marston, today we've been using the clock and 5 minutes. Are you okay if we do that on yours? Well, great. Good. So with that, we'll hear those that are in favor of the bills. Welcome. Thank you very much.
Again, Elizabeth Griffin from the Office of the Attorney General. The Attorney General supports Senate Bill 237. Thank you.
Thank you. Yes, sir. Welcome.
Good morning, Mr. Chair, members of the committee. I'm Mike Forehand. I'm with the Northern Virginia Chamber of Commerce. We represent over 650 member companies, and that's about 500,000 jobs, 500,000 people in Northern Virginia that work for our member companies. Obviously, Northern Virginia is a very diverse community, and when we talk to our members, tied for number one on the issues that they care about is regional mobility, transportation, and getting a skilled workforce, and making sure they can recruit and retain a skilled workforce. And now that it's just been announced in the past half an hour that Northern Virginia is a finalist for Amazon HQ2, we hope to have 50,000 more jobs that we need to fill in Northern Virginia sooner rather than later. And for that reason, the Chamber and our members support making sure that every student who pays taxes and meet the criteria for in-state tuition has the ability to go to institution of higher education and gain the education that they need going forward to fill our workforce needs. So for that, we support the bill and thank Senator Marsden for bringing it.
Okay, welcome. We have about 3.5 minutes.
Thank you, Mr. Chairman. Josh Levy with the Northern Virginia Technology Council. I will just associate myself with many of the points made by Mr. Forehand and also observe that many of the job vacancies that Senator Marsden had articulated are in the technology community up in Northern Virginia where
Great.
our members
Thank you for coming by again. Good to see you, Josh.
Good morning, Mr. Chairman and members of the committee. My name is Maro Park. I'm here on behalf of NACASEC, a national Asian American community organization. And I also stand before you as an undocumented immigrant. I immigrated here on winter of 1999, and I've been a Virginia resident since then. I'm here to plainly state that DACA is a false promise, and basing our state education policy on DACA, whether students hold DACA, is a blind and divisive policy decision. As Senator Marsden stated, there are 12,000 DACA holders in Virginia, but more importantly, there are 300,000 undocumented immigrants, 24% of which are Asian Americans. I urge you to make policy decisions that protect those who are undocumented and immigrants, and policies that do not divide immigrants. Thank you.
Thank you so much for coming.
Good morning, my name is Maria Ortiz. I'm a DACA recipient and I'm a proud product of the Fairfax County Public School Systems. They have invested in me from kindergarten to 12th grade. I'm a current student at George Mason University where I'm majoring in government and international politics with a minor in international security. And without these bills, my future is in jeopardy, and I hope that you will support these bills, which will only create a more equal and accessible education system for our Commonwealth. Thank you.
Thank you for coming. Yes, yes, ma'am. Welcome.
Hi, my name is Bina Lothe. I'm a constituent of Senator Donovan, and I'm here to strongly express my support on behalf of these bills.
Great. Thank you for coming. Yes.
Hi, I'm Sarah Darso, and as an ally to the undocumented students in my community, I'm a constituent of Amanda Chase, and I would like for you to support this bill for all the undocumented students who deserve in-state tuition. Thank you.
Great. Thanks for coming. Yes, sir.
Good morning. My name is Simon Sandoval-Moschenberg. I'm legal director of the Immigrant Advocacy Program at the Legal Aid Justice Center. I'm a constituent of Senator Marsden. I'm here to satisfy you that this bill does not violate 8 U.S. Code 1623 because the provision is not based on residence, but rather where you graduated from high school. There have been court opinions in California and Kansas that have so held. So you can feel free to vote for this bill in full knowledge that it's in compliance with federal law.
Great. Thanks.
Good morning. I'm Lilla Wise. I represent the Arlington, Alexandria, and Falls Church School Boards, and we have been in favor of this legislation for probably 8 or 9 years and would love to see it pass finally. Thank you.
Thanks for coming today. Okay. Yes, ma'am. Welcome.
Hi. Linda Higgins. I am here with the Virginia Interfaith Center for Public Policy, and we are in support of this.
Great. Thank you.
Laura Gorin with the Commonwealth Institute for Fiscal Analysis. We support this bill. Going to college helps people contribute more to the economy.
Very nice. Thank you for coming. Yes. Yes, ma'am.
Good morning. My name is Jeanette. I'm a DACA recipient, and I'm also a VCU student. And I have invested more than $30,000 in my education the past last four years. So it will be an investment. And so I hope that you can take this as an opportunity.
Great. Thanks for coming. Yes.
Hi, I'm Lana Heathday Martinez. I just wanted to express my support for the bill. I have family members who, in fact, there are siblings, and one has DACA and the other does not, based on when they arrived in this country. And so they both should have the opportunity to pursue their education. They're only 2 years apart, and one has the opportunity and the other doesn't. So please support the bill.
All right, Senator, we've run out of time, but I do want to hear from these individuals. I think I'm going to just put another minute, let these people kind of, but cycle through in that time, and we'll look forward to it. We'll add another minute to the other side, too.
Good morning. My name is Sheldon Williams. I'm with the Virginia Coalition of Immigration Rights, and I support this bill.
Great. Thanks for coming.
Good morning. My name is Diego Arturo Orbegoso. I'm from Limatamo, Peru. I'm a policy consultant for the Virginia Latina Advocacy Network, and we support this bill.
Thanks. All right. If you could state your support, that would be very helpful.
Kevin Mauer at the Virginia Catholic Conference. We support the bill. Just to be clear, Dreamers are future priests and other leaders in our community, and we should invest in them the same that we invest in other Virginia students.
Thanks for coming. Yes.
Charlie Schmidt with the ACLU. We support this bill. Thank you.
Good. Thanks for coming, Charlie. Yes. Welcome.
Luis Angel Aguilar from CASA. I also have DACA. The reason why I'm here is because I did not go to college because of the absurd rates, and that's why I'm here fighting, and that's why I do advocacy now.
Great. Thanks. You want to state your support too?
Good morning, Amanda Silcox. I'm a representative of the Evangelical Lutheran Church in America, and we support this bill.
Perfect. And you as well. Yes, sir. Welcome.
Edgar Aranda Llano, I am the chair of the Virginia Coalition of Latino Organizations. We support strongly this bill.
Perfect. Thank you.
Thank you,
All right,
Mr.
well
Chairman,
done.
for the extra minute.
Okay, great. Basically, what we do is we have a kind of the maximum clock in this committee is 7 minutes. We agreed on 5, but we did have a little latitude. But in general, once we hit the 7, we're kind of done. So, all right, very good. Is anyone here to speak in opposition to 810 or 237? If not, I think what we'll do is we'll take up the bills separately. And first, let's take up 810. That one has a little bit different tenor to it. And are there questions about that bill? I have some, but I want to hear from others first. Okay. Senator, until I read the bill earlier, I had not seen this version of the bill, and it is a different group. I tend to believe, and maybe some others do too, that we have got to fix this problem at a federal level. I think we probably all agree on that, and I hope that we do. Senator Howell and Senator Sasslaw and I are on a subcommittee of education upstairs, including higher education, for this particular bill, the 810 bill. I'm not sure if there's a way to take the subject matter up there without the bill. I think we can, but it seems to me that this is a group that we should look at very closely and see if there's not a way to deal with this upstairs. But just wanted to let you know that maybe there's an interest in seeing about that. I think Senator Donovan is also in that subcommittee, and she's expressed a similar interest in case this bill doesn't go forward because of some of the federal issues that the subject matter may be able to be looked up upstairs.
Yeah. Mr. Chairman, just very quickly, on the federal issues, I guess that what the intent of this bill is that, as we've seen, these kinds of federal issues tend to go on and drag on, and we're dropping people out of our system, our education system and our economic system, and they're not able to compete and they're not able to contribute. It is a question, once the federal government settles this, fine, however it goes, whether people have to be removed from the country or they get to stay, that's the federal decision, and I respect that. But in the meantime, time's a-wasting. We have got to get these folks involved because we'll pay the price for it later. Thank you.
Great. The bills are before us. Is there a motion on the bill? All right. Let's take them separately, if that's okay, Senator. So the senator has moved that we report Senate Bill 810. All those in favor will record their votes aye. Those opposed, no. Clerk will close the roll.
Yeas 7, nays 8.
And without objection, the vote will be reversed and the bill will be PBI'd. Next up, is there a motion on Senate Bill 237? All right, there's a motion and a second that the 237 report. All those in favor will record their votes aye. Those opposed, no. And the clerk will close the roll.
Yeas 7, nays 8.
Well, without objection, the same will be done. Senator, do you mind working with Senator Donovan on the subject matter and see about, especially in 810, it's a new subject matter for me, and do you mind working with him and that subcommittee on public education, higher education, maybe there's a way that we can work on this?
I'm appreciative of the opportunity. Thank you, Mr. Chairman. Members
Thank you
of the
so
committee.
much for coming. Oh, okay. And also work with Senator Chase. I apologize. Very good. With that, there is one bill. I know that I told Senator Locke that would go. Senator Cosgrove's got to leave to go upstairs. Can he take? Yeah. You've rescheduled. Perfect. Good. Senator Locke, you have two bills before us. Would you consider maybe taking up Senate Bill 775 first, ma'am?
Thank you, Mr. Chairman. Senate Bill 775.
The committee will bring their attention to the bill. I'm sorry, Ms. Which is 775. Yes, ma'am. Thank you.
Is support for military families in temporary housing. And what this bill would do is it would permit children in military families that have recently relocated into an area and are residing in temporary housing and are awaiting their permanent housing to enroll in the school division where the permanent housing will be located, free of tuition. These families would be required to provide military documentation to indicate the relocation, and within 120 days of enrollment, proof that the permanent residence was established. This would also allow the children of military personnel who have received orders to relocate or to be deployed to continue to attend their current school tuition-free through the end of the school year, even if the family moves outside the school division. The bill provides that the school division is not responsible for the transportation for these children while they are living outside of the school division. Also, the children will be counted in the average daily membership of the division where they are enrolled. This came out of a study for military, through the military liaison officers, and it's been addressed on multiple occasions, and it had been a problem for families as they were relocating, so this solves that problem.
Great. Senator Locke, I think the bill is a good bill and probably in good shape. Is there anyone here that'd like to speak in favor of the bill that you know of?
I know Cindy's here.
Oh, yes, Cindy, welcome.
Good morning, Mr. Chair, member of the committees. Cindy Cave, Assistant Superintendent for Policy for the Department of Education. This bill was brought together because of the work of the Virginia Council, which the GA established in 2009. And that Virginia Council works with the Interstate Compact on educational opportunities for military children. The problem of being able to enroll your child in the school division where they'll finally be going to school was discussed in the Virginia Military Council. They asked us to put together a task force to take a look at it. We pulled together members from school divisions that have a high impact on military families and also the military liaison officers, and they recommended that we have a bill that could address this that would help the families.
Great.
So.
Great. Is there anyone in the room that is in opposition to this bill? Seeing none, Senator Locke, does that complete your kind of presentation? If so, is there a motion on the bill?
Mr. Chairman.
Oh, that's right. Tom's got a technical amendment. I apologize. Tom, will you report the technical amendment?
Thank you, Mr. Chairman. There's an and in the wrong spot. I need to move it from line 98 to line 102.
All right. All in favor of changing the and will say aye. Opposed, no. And the bill is amended. And now it's a motion from Senator Black, seconded by Senator Peake, to report the bill as amended. All those in favor will record your vote aye. Those opposed, no. Senator Locke. Carrico. Maybe just sit her button down there, Janet. No, all good. Well done. The clerk will close the roll. Ayes 15, noes. Yep, go ahead, Ms. Madam Clerk.
Yeas 15, nays 0.
All right, and the bill is reported. Thank you, Senator Locke. You had one more bill, which is Senate Bill 133.
And there is a substitute.
Okay, there's a substitute.
Move the substitute, Mr. Chairman.
There's a motion and a second that the substitute to Senate Bill 133 be adopted. All those in favor will say aye.
Aye.
Opposed, no. And the substitute is adopted. Senator Locke, welcome. Thank you for coming.
Okay. And the substitute changes from the previous bill that was introduced. It no longer addresses the issue regarding waivers of informed consent. It completely repeals section 18.2-76 of the Code of Virginia. Because women should be able to determine what is in their best interest regarding what is necessary for them with regard to medical care, and should not be subject to legislatively established barriers that are created simply to impede access to their personal and private pregnancy decisions. So what the substitute does is to repeal that section of the code.
Great. Are there questions to Senator Locke about the substitute as we have presented it? Senator Black?
One quick question. It says that it would prevent the review of with the woman of specific information or materials before an abortion. The bill that, or the law that requires parental consent prior to an abortion requires the completion of a notarized consent from a parent. So as I read it, that would also be knocked out, so that would eliminate parental consent for abortion.
That section of the code is being repealed in the substitute.
Thank you.
Any other questions to the patron? Hearing none. Senator Locke, we talked before, and I think we've agreed not to a 3 or a 5, but a 7-minute clock on this bill. There's been a lot of work on this one, so with your concurrence, we'll set a 7-minute clock, and those that come after the 7 minutes, if they do, we'll just let them state their name and their opposition. So if that's worked for you.
Sure.
With that, we'll hear those that are in support of Senate Bill 133. Welcome. Yes, ma'am.
Thank you for having me. My name is Megan Kinkle. I'm a constituent of Senator Peterson. I'm also a labor and delivery nurse, and I'm here in support of SB 133. So our patients rely on medical professionals to help them make the best decisions for themselves. But when the government actively and intentionally disrespects this patient-provider relationship, you put our ability to deliver high-quality care in jeopardy. Informed consent laws allow the government to intervene in the information a patient receives, subjecting them to misinformation, judgment, and stigma about a personal and private medical decision. Furthermore, requirements like the mandatory waiting period purposefully delay abortion procedures, which can jeopardize a patient's health and safety and access to care. The medical community does not need the government interfering with when we deliver our care, putting both our patients and our ability to provide best practice, high-quality care at risk. Please support SB 133. Thank you.
Thank you for coming. Yes, welcome.
Good morning. I am here again on behalf of Caitlin Blenny, one of Senator Saslaw's constituents. She says in support of this bill, before my abortion, I had spent the past 5 years believing I would never be able to have children because of medical problems that caused infertility. I had assumed my symptoms were due to my previous medical conditions and the stress of transitioning to a new job. But because of my transition to a new job, I had a gap in insurance coverage and waited to see my doctor until my coverage began. By the time I finally saw a doctor, I was almost 9 weeks pregnant. I knew I wanted to have a medication abortion, but I had only 3 days until that was no longer legally possible in the state of Virginia. Virginia's restrictions, including the mandatory waiting period, left me with no other choice but to travel to a different state. The hardest part wasn't getting the abortion, it was figuring out the logistics of getting an appointment and the care that I needed. Virginia's informed consent restrictions almost blocked me from exercising my constitutional right to abortion. Please support SB 133 so others can access quality health care with dignity. Thank you.
Thank you. Welcome.
Good morning. I'm reading on behalf of Alex Hillebrand, a resident of Arlington and a medical student at Georgetown University, and I support SB 133. According to the Medical the American Medical Association's Code of Ethics, all patients have the right to make informed decisions about the medical care after a thorough discussion with their physician. These rights extend to Virginians seeking abortion care. The concept of informed consent comes from the basic right of all patients to determine what will be done to their bodies. It does not include biased, state-mandated, non-medical information or unnecessary state-mandated waiting periods or state-mandated imaging in the form of an ultrasound. This bill recognizes medically appropriate counseling does not include government interference. When I'm a physician, the conversations that take place between me and my patients will focus on her medical needs. I will provide all the options to her in a timely, unbiased, non-judgmental manner, and only she will be able to give informed consent to any treatments that we agree are best for her. I ask you to vote yes on SB 133 because as a medical student, I believe my future patients deserve to make decisions about their own health care without interference from the state of Virginia. Thank you.
Great, thank you. We have about 4 minutes left. If you have long statements you'd like to leave them with the clerk, we can do that. So
my name is Jessica Lundberg. I'm a resident of Alexandria, and I ask you to please support SB 133. When my husband and I decided not to become parents, I was nervous about telling my OBGYN. I was relieved, however, when he discussed with me options to prevent pregnancy without judging or questioning my decision. People who have made the personal decision to end a pregnancy deserve the same level of non-judgmental care and respect. SB 133 brings back true informed consent that does not require medically unnecessary information, testing, or delays in care. It allows confidence that their doctor will provide timely care free from judgment and stigma. Please support this bill.
Thanks for coming. Yes, ma'am. Welcome.
My name is Lori Farnsworth, and I live in Alexandria. A close family member of mine made the decision to access abortion care with his partner many years ago. They were in no position emotionally or financially to start a family. Both of these young people have since carried on as contributing members of society, so I am left wondering why abortion-seeking patients are singled out for state-written materials. And why should a woman be required to keep a waiver of a waiting period for her abortion in her medical records like a scarlet letter setting her apart? I fail to see the state's compelling interest, and I feel it stigmatizes people seeking an abortion. Passing Senate Bill 133 restores dignity and respect to those seeking safe, legal medical care.
Great. Thank you for coming back. Yep.
Gail Dady with the ACLU of Virginia again. Just to quickly clarify, this bill does not affect the parental consent statute. While ACLU of Virginia would support repealing that statute in addition to this statute, this does not affect the parental consent requirements. All this statute does is repeal the informed consent provisions that are already required of licensed physicians to provide to their patients. Thank you.
Good. Thank you. Welcome back. Yes, ma'am.
Galina Vachena from Nero, Bochos, Virginia, and we, of course, support this bill. Women should not have to go through additional, jump through additional hoops to get necessary medical care.
Great. We appreciate you coming by. Yes, ma'am. Welcome.
Good morning, Anna Scholl again with Progress Virginia. As you might be able to tell, I have recently made some reproductive health decisions. And when my husband and I decided that we were ready to add another child to our family, we weren't required to get government instructed materials on how or when we might go about that, or comply with any mandatory waiting period before I could become pregnant. And if something were to go wrong with this pregnancy, or we should make the decision that we no longer wanted to add another child to our family, don't believe the government should interfere in that decision either. I did just want to flag for you on the note about requiring women to look at government written materials that there is a study from Rutgers University that has found that 41% of the statements in the government written materials that are given to women in the state of Virginia are inaccurate when it comes to first trimester abortion.
Great. Thank you. We've got about 45 seconds. Welcome back. Yes, ma'am.
Thank you. Jennifer Allen, Planned Parenthood Advocates of Virginia. We thank Senator Locke for introducing this bill and urge your support. Thank you.
Thank you very much. Welcome back, Secretary.
On behalf of the administration, we support this bill. Thank you.
Thank you, sir. All right. Senator Locke, well done. Right at 7 minutes. I mean, just perfect. Your people are pretty succinct. Would you like to kind of finish up with any other comment that you may have?
No.
No? Okay. If not, then we'll hear from those that struggle with the bill, and we'll do it within the 7 minute clock. Welcome back.
Hi, I'm Victoria Cobb with the Family Foundation. The principle of informed consent runs through the entire medical arena. We use it for a lot of reasons. It enhances the relationship between the patient and the doctor, and frankly, it's a litigation reducer. People know what they're going in for, they understand the risks, they understand the potential. More than this, it's important to understand that in the case of abortion, these are tough moments. These are unplanned moments. These are definitely the moments where there is an opportunity for someone to need time to think because they may be under coercion from a boyfriend, from a parent. They need that moment. And when emotions run high, information is more important than in any other scenario. Frankly, I'm actually glad they took away the waiver because since we've done the inspections of all these abortion facilities by the state, we've found terrible implementation of processes like our law on parental consent. So we were concerned, even if this idea was agreeable, the waiver would never be implemented well. It's an alarming thing to think about removing informed consent from our process. No matter the choice a woman ultimately makes, every woman deserves as much information as possible so she can make her choice with knowledge and live with less regret and less second guessing. Thank you.
Thank you for coming. Yes, ma'am, welcome back.
Again, my name is Olivia Turner, and as I've said before, I'm here representing not only unborn children of Virginia, but most definitely the mothers, the women of Virginia. And as I said before, as a woman who's had an abortion and for 35 years has listened to, counseled, shared, wept, and cried with women who did not feel that they had adequate information before making their abortion decision, I think it is an absolutely foolhardy and frightening situation where anyone would suggest that we would allow a woman, simply because we get pregnant, to make the decision without adequate information about what will happen to us physically, what the nature of our pregnancy, the stage of our pregnancy, the name of our abortionist, that the very basic matters of medical care that, as Senator Donovan could tell you so clearly, are essential to letting a woman feel empowered, competent, and capable, would be denied under this bill. We urge you to be very aware that this is an effort to weaken one of the strongest, most protective laws the Virginia legislature has passed in many years regarding our right to know everything that will happen to us, about us, around us, and for us when we are pregnant. The reality that we would suggest that women don't want to know this is simply because women don't know what they don't know. That is the critical character we are talking about here. We urge you to oppose this as a definite, direct weakening of one of the most important bills that not only protects women and their unborn children from the unscrupulous nature of those abortionists who would deny them this information, but it also has proven to bring down the numbers of abortions in Virginia. Numbers of abortions are dropping year by year by year since the passage of these protective laws. To remove that protection for women would again be protecting abortionists who, according to the Department of Health, have not been, there's not been any need in the last 4 years to reproduce the informed consent booklet. I would ask this legislature to ask the question of the Department of Health and our OBGYNs in the state, why aren't those brochures needing to be reprinted? Are they not being handed out now? Because women have the right to know. Please oppose this bill.
Thank you. Do you mind taking a quick question? Senator Black would ask a question. I have
Of course,
paused the
Mr. Chairman.
clock for that.
If I could, is it reasonable to believe that in the course of the bills that would be deleted by this, that there have been literally thousands and thousands of children who have been allowed to be born and to live productive, happy lives because of this momentary delay in which a woman has the opportunity to think about what she's doing and to be completely informed of it.
You do make an excellent point, Senator. We know that the national figures are that where women have access to women's right to know laws like this one, where the information is required by the abortionist to provide to the woman this information, women are making decisions to preserve their children's lives and proceed with life-affirming decisions because they get more information about the children that they're carrying, the fetal facts of life, as I call them, but also because that waiting period, particularly if there is coercion. I was coerced by my boyfriend into having an abortion. It was an adamant situation, and I was unsure of my capacity to resist. his strong, strong pressure. So in result, unfortunately, no abortionist I spoke to told me that I did not have to do what he was forcing me to do as a college student. So the reality is that 24 hours with information required by law to be provided to her that she does not have to follow through on coercion, whether it's a boyfriend, husband, someone else in her acquaintance who is putting pressure on her. That 24 hours might allow her to seek the counsel and advice that will preserve her from finding herself in an unwarranted, dangerous situation. So again, in this climate, we're concerned about sexual assault, etc. I would think that we want to do everything we can to preserve the measures in place in Virginia to protect women from different kinds of assault.
Great.
Thank you.
Thank you very much. And you guys have about 2 minutes left. Yes.
Mr. Chairman, members of the committee, thank you. Bill Ray with the Virginia Catholic Conference. We also oppose this bill, and I'd just like to echo the excellent testimony given in opposition to it today. Thank you.
Perfect. Okay, very well. With that, Senator Locke, why don't we let you kind of sum up, and then there'll be maybe questions or statements from the members.
Mr. Chairman, while I appreciate everything that has been said in opposition to this bill, quite frankly, a woman's right to choose is a woman's right to make the decision about what she's going to do with her body. It is not the decision of men, who generally are the ones who make these laws. It is a decision of a woman, her physician, who will provide her with the information that she needs. And I think we put ourselves in the wrong position if we think that a woman is ill-informed. And that she cannot make that decision for herself. And so I think that, and that she does not have the adequate information to make that decision. So I think that, that we are the ones that are ill-informed if we think that women can't decide for themselves.
Senator Locke, thank you very much. Are there members, Senator Chase?
Thank you, Mr. Chairman. Senator Locke, I would just say to you, I think you and I are great examples of empowered women who actually do make and pass laws, and I'm very honored and thankful to be here today. Senator Donovan as well. All women who are empowered, who are put here by the people to make these laws. I would say a couple things. First of all, what we're being asked to do as legislators is oppose more education for women, more information to women. If we're going to empower women, we need to inform them. And allowing them that 24-hour period allows for a cooling off period. And I know many women in this situation who have had abortions who have later had regrets because they were not allowed the time to cool off and make rational decisions. They were not allowed, they made a rash decision. They did not inform the father. We're only talking today about a mother's right. I think we need to start entering into this equation. What about the baby's rights? What about the father's rights? There's three human beings involved in this equation, and we're only addressing one, and that's very disheartening to me. But I think we should empower women by informing and educating them and allowing them to have that 24-hour cooling off period so they can make a rational decision that's going to affect them for the rest of their life, that they don't have to live with the guilt and the regret that a lot of women have to live with. Thank you.
Yes, Senator Saslaw.
As far as the male having a decision in this, I've been here a long time, and I've served with people here in this General Assembly who thought that if that woman was raped, she ought to have to carry that pregnancy full term. And if there's anybody in here who thinks that kind of they ought to bring the rapist into the equation, they're crazy. And quite frankly, this is I've never had any woman and I assume that that's what half my district is, ever complain to me saying, geez, I wished I'd have had more information. If they go in to get a hysterectomy, we don't tell them you got to wait 24 hours, and we shouldn't have to tell them on this. And to think that somehow or other they're coming in here and they're not fully informed or they don't know what an abortion is nothing short of absurd. I can't believe what I'm hearing. Thank you, Mr. Chairman.
Okay, thank you, Senator. Hearing none others, is there a motion on the bill?
I move be reported.
There's a motion and a second that Senate Bill 133 be reported as amended. All those in favor will record their votes aye. Those opposed will record their votes no. The clerk will close the roll.
Yeas 7, nays 8.
Okay. Without opposition, we'll flip the vote.
Sure.
So, Senator Locke, thank you for coming
Thank
today
you.
on both of your bills. Guys, we have limited time, but if you don't mind, I'd like to move through quickly. There is one bill that is on your docket, which is Senate Bill 259. It is Senator Stewart's bill. Honestly, I misread the bill a couple of days ago, and I was going to roll it or ask you to roll it into another bill. That is not appropriate. I would like to ask that that bill, and only that bill, go by for the day without objection.
So moved.
Okay, it's moved and seconded, but without objection. All right, next up is Senator Cosgrove. You have Senate Bill 243. Then we'll go to Senator Peterson. Senator Peterson, you're ready to do your bill after that? Okay, after Senator Cosgrove, and then we'll hopefully merge together Senator Donovan and I's bills, and we'll be done for the day. Senator Cosgrove, welcome on
Thank
Senate
you,
Bill
sir.
243.
Yes, Mr. Chairman and members of the committee. Senate Bill 243 would establish a fund to provide hyperbaric oxygen therapy to those veterans who have been diagnosed with post-traumatic stress syndrome or traumatic brain injury, also known as TBI. There's anecdotal evidence that oxygen saturation has been very beneficial in healing many different types of wounds, including brain abscess. This bill doesn't really do anything except set up a shell where funds can be garnered, taken to the state, and we can provide this type of service to those veterans who we're already treating, by the way, in our new facilities in Virginia Beach and in Northern Virginia. I have numerous friends from my time in the Navy, and also I have a very close acquaintance who's a Green Beret. We have a lot of friends that come back from our nation's defense and are severely injured with these injuries that are not visible to the naked eye, but they affect them and their family extraordinarily difficultly. Mr. Chairman, I know this bill would have to go to Finance.
It will.
And where it should go after this, but I hope that the committee will see the wisdom in providing the ability to provide this treatment to our veterans.
John, well
Mr.
done.
Chairman.
Other questions?
Mr. Chairman.
Senator Howell, then Senator Sasslaw.
Thank you. It's not so much a question as just a comment. I think this is a really great bill. I totally support it. But I think the federal government is just negligent.
Yes,
That's
ma'am.
the nicest thing I can say about how we treat our veterans. And as Virginia does the responsible thing and steps up over and over to assist them, I think we need to keep the focus on the federal government's responsibility as well.
Mr. Chairman, I agree wholeheartedly.
Senator
with that.
Sasslaw, I think you have similar concerns, right?
I was surprised that, in just standard treatment, for veterans, no matter where they wind up. And I like your bill. That's not a problem. But why is this not standard treatment for people who have PSTD?
Mr. Chairman, there are many different approved by the FDA illnesses for hyperbaric oxygen therapy. Gaping wounds are one, crush injuries are another, brain abscess is another. This is one of those therapies that's right on the edge. Just as the governor mentioned in his State of the Commonwealth, Virginia is right about there on coming with some really great medical procedures, and this can fall right into that category.
Perfect. Do you have anyone that's traveled to speak in favor of the bill, or we?
No, sir, we just didn't have the time to get.
I understand. Yes, sir. There's a motion and a second that the bill be reported and re-referred to Finance. All those in favor will record their votes aye. Those opposed, no.
Senator Carrico, would you vote me aye, please? Never mind.
Close the
I'd rather
roll.
he did it.
You get to vote twice.
Yeas 15, nays 0.
All right, yeas
Thank
15,
you,
no
Mr.
0, and
Members
the
of the
bill's
committee.
reported. John, thank you for bringing that forward. Chap, can we get your bill?
Yes, sir.
Which is 258?
This is Senate Bill number 258. Mr. Chair, ladies and gentlemen of the committee, I'll just do it from my seat. This has to do with Department of Health Professions and the ability to serve subpoenas in administrative proceedings that they have Basically, it allows the recipient to receive a subpoena by mail, by mail and other methods, but it also allows them, if they agree, to receive it by email, which is quite frankly how we do it in law practice right now. If you agree to accept service by email, then email can be effective. But it just makes the process by which the Department of Health Professions conduct their administrative proceedings more efficient and make sure all the parties get to the table. I did have one amendment, Mr. Chair, which is technical. On line 27 where it says enforcement of the subpoena in the jurisdiction in which the recipient resides is found or transacts business. That actually is duplicative to the line above, so I just changed that to in that jurisdiction, period, full stop.
All right. So, Chap, there's nothing in here that you think means it needs to go to courts. I mean,
No.
it's different, but not unusual, right? Is that right?
Right, no, this is an administrative proceeding. So
All right.
there's
Does any member of the committee have any concerns about the bill? I think right now, as you've indicated, even on the email section, as long as it's consent.
It's got to be consented by the recipient.
All right. If not, is there a motion on the bill?
Can I get the amendment first, please?
Yes, sir. So.
I move the amendment.
All right. All those in favor of the amendment will say aye. Aye. Opposed, no. And the amendment's agreed to. Is there a motion on the bill?
Move to report as amended.
There's a motion and a second that the bill be reported as amended. That is Senate Bill 258. All in favor, record their votes aye. Those opposed, no. We good? Clerk, close the roll. Okay.
Yeas 15, nays 0.
All right, it is 15-0. The bill is reported. Up next, Senator Donovan, do you mind just even from there, yeah, or wherever you want to do it, just, and I'm fine to roll mine into yours
Thank you so much.
or
This
other way around. Yep.
Senate Bill 724 basically takes our online network authority that we're really trying to get some steam behind to make online learning accessible in Virginia for people who may not have the time to attend classes. And it is putting on the board members of Virginia Community College. And that basically allows us to leverage some of the services that they have for students, a seamless portal, access to financial aid and other things. It's really just an opportunity to make this program accessible to about 2,500 additional students.
All right, very good. Tom, do we need, wait just a second. Tom, do we need any amendments, or are they identical as they are now? I thought yours had a different name for the community college, isn't it?
I'm amenable to any amendment. Well, maybe not any amendment.
Senator, because, do you mind if you roll yours into mine just for
That's
that
absolutely
purpose?
fine.
So there's a,
Mr. Chairman.
okay. Okay, so there's, what we'll do without objection is we will roll Senate Bill 724 into Senate Bill 760 without objection. And now there's a motion that that bill be reported. All those in favor will record their votes aye. Opposed, no. And the clerk will close the roll.
Yeas 15, nays 0.
All right, does that, thank you very much, yeas 15, no 0. Is that complete, the docket? If so, I want to thank you all. This was not going to be the easy day. The rest of them should be easier. And I want to thank you, and also want to thank the patrons on all sides and our audience. I think we've put this clock in place, and we know in many cases what we're going to do. But to the members, thank you for helping us get through this day. And from here on out, it should be easier. So thank you all. The committee will rise.